All right, everyone. For those online and in the room, let's take our seats. We're going to go on and bring the Appropriations Committee public hearing regarding the deficiency bill to order. It is now 10:03. I can't really go to our vice chairs or other co-chairs of the committee other than Senator Austin. Senator, do you have any comments? Let's get it going. Mr. Beckham, Mr. Secretary, you have the floor, sir.
President Paris, good morning. Congratulations on your promotion. Senator Austin, good to see you and the members of the committee. Yes, we're here to talk about our deficiency appropriations bill, which happens to be House Bill 6863. As we do every year, we account for deficiencies in state government with a combination of things. Part of it is the legislative deficiency bill. Part of it is Finance Advisory Committee transfers that we do throughout the year, FAC transfers, as well as adjustment of administrative holdbacks that we have on agency expenditures. So the bill you have was what the world looked like to us in January. We have every month in our monthly letter to the comptroller given you a sort of a rolling draft of what the deficiency bill will have to look like, or at least in terms of the total picture. The deficiency bill represents a fraction of what we actually have to do to make sure that we wind up in balance and under the cap for the year. But we will have to update even where we are today by the time we do the final enacted deficiency bill, either in May or June, whenever we do that. So as we do every year, we work with OFA and this committee to make sure that that final bill does what we need to do in terms of the legislative portion of dealing with our deficiencies. So we did have some challenges this year. We have a relatively large number of identified shortfalls, as well as overall spending levels that continue to challenge us to stay under our spending cap. The bill, as always, makes appropriations for those deficiencies, and it makes de-appropriations in those places where we have lapses, and that partially covers the new appropriations. But of course, we happen to have some spending cap room this year. So part of what we do in the deficiency bill is we're going to spend the rest of our cap room in 25 to make sure that we're covering all of the expenditures that we expect agencies to make. We will have agency testimony later on that is specific to their programs and shortfalls. So I won't go into too much detail on that. But we do have additional descriptions of the shortfalls that we projected that were part of our March letter attached to our testimony here. And I'll just draw attention to, there's 3 updated notes in there. One is related to DEMIS. That's on page 4 of the attachment. It notes that as a result of some FAC actions, we have dispensed with all of the shortfalls there except for the PS shortfall. So we used some PS room to cover all the rest of them. So what's left is the PS, personal services shortfall in DEMIS. As well in DSS, we've accounted for all of the programmatic deficiencies as a result of FAC action, including about 26 million of the Medicaid deficiency we've dealt with so far administratively and with the help of the FAC. There is all that remains there is the balance of the Medicaid deficiency to date. In terms of Department of Corrections on page 6, we've also as well taken FAC action to eliminate all of the programmatic account deficiencies other than personal services. So those are the updated notes from those 3 agencies since the March letter. Obviously, we'll have another letter next week and one again in May before the end of the session. So still lapses and deficiencies yet to be determined, but we will make sure that the final deficiency bill covers what we need it to cover in terms of the legislative action, and we'll be working with you to do that. I'll conclude there, and we're happy to take any questions you have about the deficiency bill.
Thank you, Mr. Secretary. We're going to stick to 2 questions. Nothing's changing. Representative Nuccio, we're going to stick to 2 questions per member and try to get through to a second time if we can. Yes, ma'am. Are there any questions from the members? Representative Nuccio.
Good morning, Secretary Beckham. How are you?
Good morning. I'm well, thank you.
So knowing 2 questions and then I can come back for more. Just to confirm what you said, do you believe the numbers that are in here right now are the best forecast that you have? I was wondering if you could kind of give a little more detail because the shortfall is about 540 million at this point. And you had said a few of these areas in here, you had met the shortfall in, is that included in these numbers here? Or is there something else that we can expect to see that shows that?
So the attachment to the testimony includes the notes by agency of the deficiencies that were recognized in the March 20th letter.
Mhm.
We'll have a new letter next week. But I was drawing your attention to 3 updates that we know of in DEMIS, DSS, and DOC since the March letter. So we'll have a new letter next week, could have different numbers in it. The May letter may have different numbers as well. We are always trying to, either through FAC action or other administrative action, minimize deficiencies and move money around so we don't have to come to you for a deficiency appropriation. So it's all a work in progress, and before the end of the session, we'll work with this committee and OFA to make sure that the last version has the exact numbers we need for appropriations and de-appropriations.
Okay, so, some changes to this, but I guess, especially with Medicaid, is the intent that you are going to attempt to get these numbers to a place where we don't have to, we're not over the spending cap? Is that the absolute intent? And
Yes.
I want to be sure that I fully understand that the governor's organization, the OPM, is going to be looking to appropriate all of the spending on here and not push any offside.
We will do our best through FAC action, administrative action, including release of holdbacks, and the deficiency bill itself, to make sure there's authority to cover everything in the current fiscal year. Our last letter in March alluded to the potential this year of getting to a point where we didn't have everything covered, and that would have to go into the next fiscal year. It was only about an $8 million issue as of the last letter. We're hoping it's not an issue by the time we get to the end of the session, but that's to be determined. But as we do every year, we will assure that we have appropriations for all the money that is being expended.
Okay, so I just want to be sure that I understand this then. The intent is that through holdbacks or whatever other action, FAC, that we will have the spending under the spending cap, and we are not going to be pushing things off for the quote unquote entitlement expenses, that we are going to meet the levels, and we are not going to go over the spending cap in this year based off of the actions that you guys are taking.
We will do what we've done every year for the last several decades, which is we will cover all of the expenditures through appropriations from the General Assembly. We do have an extraordinary situation this year, as I indicated in my testimony, of a large number of identified shortfalls as well as a large increase in spending. We did not adjust the budget last year. That has added to our difficulties. We've had to account for essentially 2 years of growth in this year without that adjustment. So we are, and we alluded to this in our last letter, having the prospect of possibly holding bills so that we would pay them in the next fiscal year. But that would be a deficiency then in the next fiscal year that we'd have to account for theoretically. But it's our intent to make sure we get to the end of our year without that happening, and we're doing everything we can to make sure we do.
I appreciate that. Thank you.
Thank you, Representative. Thank you, Mr. Secretary. Are there any other questions or comments for the Secretary before us? Seeing none, Secretary Beckham, thank you for your testimony. We appreciate that. Next up, we'll have the Comptroller's Office join us.
Morning.
Good morning.
Thank you for the opportunity to be here. We've submitted some testimony, written testimony that kind of outlines the deficiencies that we're addressing, particularly related to adjudicated claims and fringe benefits and supplemental benefits. Happy to answer any questions that you might have.
Thank you. And would you also please state your name for the
Sure.
record? Thank you.
Tara Downs, Deputy Comptroller.
Thank you. There's submitted testimony. I already see one person with questions ready. Representative Nuccio, for the first time this round, ma'am, you have the floor.
Thank you. Thank you for coming. I do have a question in regard to the adjudicated claims, as you mentioned. We're seeing a severe uptick in the healthcare for current state employees and retired state employees. I know a lot of the healthcare falls under the Comptroller's Office. I've been asking this question, and I don't feel like I've really gotten a good answer for it yet. What are we doing with our health carriers to really go in and look at the reason for the uptick? And I ask this in specificity to also what is in the budget, looking at the uptick there. So I'm wondering, with that deficiency that we know in the growth there, what is the mitigation plan that the comptroller is using?
Is this, point of order, Mr. Chair, is this relative to the, upcoming budget or the deficiency plan that stands in front of you? Because I don't think that this is relative to the deficiency plan that we have in front of us. This is relative to, possibilities of, an overrun in the next budget relative to state employee health care. That's not part of this deficiency bill here in front of us today, and the questions are not on the upcoming budget. They are on the deficiency plan.
I believe she just said that it was adjudicated claims was part of their deficiency.
But adjudicated claims is not state employee health care. That is not state employee health care, either retired or active. Adjudicated claims are claims relative to primarily out of the Department of Corrections relative to people who are wrongly incarcerated through our judicial system, wrongly incarcerated relative to being arrested, and then found not to be culpable of those crimes. And there is a very small amount left relative to a lawsuit brought by the State Employee Bargaining Agent Coalition against Governor Rowland, which we are trying to finish that up. But it is not relative to state employee health care and retiree health care.
Senator, hold on one second. Senator, your point of order is well taken. I appreciate that. Representative, can you please rephrase your question for the comptroller's office that is relevant to the bill before us?
Actually, my question is relevant to the bill before us. If you look at the conversation here, right, in the documentation we were just given, state comptroller is 37 million shortfall forecasted in the retiree state employee health service account, 17 million shortfalls forecasted in the OPEB. That's in this right here, in the statement that was given, in the testimony that was given, which means it is then relevant to the conversation that we are having right now.
I understand that. I'm asking you, based on what you're asking, ma'am, to rephrase the question just a little bit better so that it is more aligned with the deficiency bill before us. So exactly what you
Okay.
just stated, respectfully. Thank
All
you.
right.
Thank you.
Rephrasing the question, you are currently showing a shortage in retired state employee health plans and other post benefits and other healthcare health services account, $30 million, 37 million dollars. So in relation to that, ma'am, can you please tell me what has been the plan and what is being done to mitigate this shortfall?
Thank you, Representative. I'm going to turn it over to the Director of our Healthcare Policy and Benefits Services Division Director.
Appreciate that. Thank you.
Thank you. Thank you for the question, Representative Nuccio. In terms of the retiree healthcare deficit that is driven primarily by increases in the premium cost for our group Medicare Advantage plan, that plan has seen some of those increases relative to some changes at the federal level that changed the federal reimbursement levels for our carrier, which then impacted our own premiums. We are also seeing some utilization challenges on that plan, which are also driving up premiums. We are out to bid on that plan right now and are actually receiving back those bids this month. And so we are hopeful that we will be able to receive bids that have lower premiums than what is currently projected. So that is one component. On the active health plan and the pre-65 retirees, we are also seeing and have been throughout the course of this fiscal year an increase in utilization, and that is driven primarily in two areas. One is inpatient hospital costs, which are driven in large part through as a result of increased ER utilization. And then secondarily, we are seeing a large increase in our pharmacy costs. And that's driven by a combination of GLP-1 utilization and increased costs relative to specialty drugs. I'm going to start with the latter. On the prescription drug side, we have been in very active conversation with our carrier, CVS, around a variety of plan and formulary changes to help to manage or better manage that trend. We are also making some adjustments to our weight management program that we operate with Flight Health, adding a $25 copay associated with that. We're also tightening up our prior authorization on GLP-1s that can be prescribed to diabetics. And then we are looking at some additional utilization management opportunities relative to specialty drugs, trying to drive folks towards higher value drugs first, ones that have high clinical value, but costs.
No, do not use that one.
Sorry. And then in addition to that, we also were able to renegotiate our contract with CVS to increase their financial guarantees relative to the per member per month costs of the pharmacy plan. And so they were able to lower the amount that that they are guaranteeing on a per member per month basis, and increase the financial guarantees if they miss that. And so that should help offset some costs in the upcoming year as well. On the on the medical side and the inpatient costs, that one has been a little bit more difficult to tackle because it is a combination of higher utilization. We're seeing also more significant numbers of high cost claimants coming through, but we have been evaluating that with Anthem, and are looking at sort of two avenues there. One, working with our primary care providers, who we have risk-based contracts with, and working with them to focus on this population and try to drive down or better manage, right? So we see less of these folks ending up in the hospital. The second piece we are looking at there is on medical pharmacy, which is a very significant spend, about $150 million a year. And we are working with Anthem right now on a program to drive a lot of medical pharmacy utilization to lower cost sites of care. We think there is a very significant opportunity in terms of lowering our total net costs for those physician administered drugs, and that should be in the tens of millions of dollars. We're hoping to launch that on July 1st.
Thank you for that information. That's all really helpful. I'm glad you had that much detail. That's good for somebody like me. Are you looking at the medical trend that you've been experiencing? And it sounds like you've got some mitigation plans in place to try to lower that trend. Are you feeling fairly confident that you'll find a way to adjust some of these cost overages going forward?
We are already seeing some moderation in that trend in the last couple of months. So I do feel quite good about that. I will say this: I feel more confident on the medical side relative to starting to manage that trend. It actually does appear that, and I can't tell you why this happened, but the broader market in the fiscal year prior, state employee plan outperformed broader market quite significantly. But what was happening in the broader market is they were seeing sort of a rebound or a continued rebound from reduced utilization over the COVID period. And we didn't see as much of a rebound, but we seem to be seeing a delayed rebound in some ways. Again, I can't tell you why that's happening, but that it seems to be what's happening. But we are seeing some moderation in the last few months. And if we look at the experience of the broader market, right, they did start to moderate after after that jump up. So we are hopeful there. On the pharmacy side, I think the challenges are a little bit more significant because of the popularity of GLP-1s, the cost of GLP-1s, and the challenges they're effective, right? And so they are having meaningful impact for folks, but that will continue to be a challenge. I think the bright side on the pharmacy is that we do have these dollar for dollar guarantees with CVS. So once we go above a certain threshold in terms of our costs, CVS is picking that up dollar for dollar, up to a pretty significant amount. And so relative to that contract, I think that is going to help moderate our pharmacy trend, even though I expect our pharmacy trend not to moderate as much, if that makes sense, right? The actual underlying trend may still be high, but our experience in terms of what we need to fund through the general fund will be a little bit more moderated.
Yeah, I appreciate you mentioning the actual market as a whole, because I do find it a little weird, because I'm seeing the same sort of thing in industry. We've actually seen a decrease in inpatient claims in 2024 year over the prior years. So the fact that the state is going up while the market is going down on that is a little peculiar. So thank you for the information. I appreciate it.
Thank you, Representative. Any other questions? Representative Ackert.
Thank you, Mr. Chair. And my concerns align with the last statement from the past representative, that we went into a plan, right, that health improvement, I guess, plan type of thing for the state workers, that the whole goal of that is to, get early intervention, and to hear the usage going up is contradictory to the whole idea of getting in there and doing that. So that's a concern on that. Do we have, you say the GLP, what was as a driving cost? Is there like the drug that you mentioned on the weight loss and diabetes? What is that, since the inception of allowing that, what cost has that been? Do you have that number? And I know that's probably not off the top of your head, but tell them as much information that you have, I bet you it is.
So I do have some projections as to what we will spend this year, and this is sort of a rough projection. So I will tell you sort of on GLP-1s, when we first started looking at this, they've been on the market since sort of the early 2000s, but they were only folks only realized that they could be used to treat obesity, right? More recently they were approved to treat obesity, and that's where you sort of had a twofold thing happen. One, for diabetes, it became a frontline medication, and so initially what we saw was a lot of diabetics move onto the GLP-1s, onto Ozempic and Mounjaro. And they are very effective in managing diabetes. And then secondarily, right, we started to see costs rise relative to obesity management. I will tell you today that still the majority of the cost is relative to diabetics. It's not to obesity management, but the growth is more significant on the obesity management, which is probably not surprising. So last fiscal year, we spent about $40 million on GLP-1s. This fiscal year, we expect to spend around $65 million. So we're seeing a trend that's around 50%. So it is really significant, and you can see sort of how that can build over time. One of the challenges, just to sort of finish out this subject, is that particularly for those who are high risk, there are really significant benefits or potential benefits on the medical side in reducing chronic diseases and complications, et cetera. But those benefits are sort of out into the future, right? You don't generally see them in the first year that folks are taking the GLP-1. So you're incurring those initial costs, and then some of those benefits start to accrue on the medical side over time. We're still very much in that sort of loading phase, right? Of where we're getting a lot of the costs and not seeing much of the savings. And we'll see sort of how this works out over time. But I think we are trying to manage it as best we can, driving folks to obesity specialists when they do take GLP-1s for obesity. We want to make sure they're taking the right drug. We want to make sure they're going to stay on it. We want to make sure they're well managed and understand the side effects, et cetera, so that we're not spending the money and not getting the results.
Thank you. I appreciate that. And investment in health is important. And I get that. And I wish you good fortune and the state good fortune in your negotiations on health insurance, because as a business owner myself, I'm at about a 20% increase this year. So good luck with that. Thank you. Thank you for your testimony and your knowledge. I greatly appreciate that. Thank you, Mr. Chairman.
Thank you, Representative. A quick question for the both of you. I see that there's a surplus with the line item based on your testimony with the unemployment account. If you could just briefly tell us specifically what drove those lower than anticipated costs in the unemployment account, and whether those factors are expected to persist in the next fiscal year, as best as you can.
Thank you. I'm pulling another lifeline to our Assistant Division Director for the Budget and Financial
Thank you.
Analysis Division.
And please be sure to state your name for us, please.
I'm Carolyn Mercier, Assistant Division Director. For the unemployment, we're paying the unemployment costs for state employees. So basically, it's what the costs are coming in. They're coming in a little bit lower than we were projecting maybe 2 years ago when the budget was set in place.
Do we anticipate, with all of the changes that are happening on the federal level and with the instability that's happening in the markets, do we anticipate that maybe forecasting being different for our state in the future?
It very possibly could be. We haven't taken, that just happened after we have done our budget. So we haven't taken that into consideration. And that's a big unknown, I think, at this point on how that will affect our state employment.
But I'm sure very much a very big concern for the comptroller's office, as it is for many
It
other
definitely,
agencies.
definitely could be.
Thank you. I appreciate that. Senator Lesser, followed by Representative Corpus, followed by Senator Summers.
Thank you, Mr. Chairman. And I actually have a question for Director Wojcik, if he's, there you are. Okay. Sorry for the musical chairs. There's a certain theme today across the various agencies that we're going to be hearing from. By my reading, by far the biggest single driver of the deficiency is higher than expected drug costs. And that's true in the comptroller's books, but it's also true in DSS and elsewhere in state government. We've seen rapid, unsustainable growth in drug costs. I know there have been a lot of conversations, and I know the comptroller's office has been part of them, specifically about the role of PBMs, and I know that that's some of the work of the bipartisan prescription drug task force. Wanted to know how PBMs are currently working with the comptroller's office your PBM is working with the comptroller's office to control the cost of drugs, and there are ways to align incentives to ensure that we're getting the best bang for our buck and address the predictability issue.
Thank you, Senator. So I think what we have tried to do is really try to do just that, is try to change our contractual arrangement with our pharmacy benefit manager so that we do have aligned incentives. So when our drug costs go up, and not the cost of a specific drug, but our overall costs on a per member per month basis, they have financial liability associated with that as well. So if our costs rise, it impacts them. By doing that, it makes certain things relevant to them that otherwise wouldn't be. So for instance, drug waste. In a traditional pharmacy benefit manager contract, the fact that folks may get 14 months of fills of a prescription over a 12-month period isn't really relevant. It doesn't impact the pharmacy benefit manager in any way. And in fact, if they own a pharmacy, which they all do, it actually could be good for them from a financial standpoint. But when they are on the hook, meaning that if they go over their total cost target, they actually will have to pay us back their administrative fees. It makes it so they're much more aligned with us in working towards things like controlling drug waste, identifying opportunities to drive towards lower cost, higher value drugs. And so one of the things that we are doing actively, which we have never done in the past, historically, we would just leverage the pharmacy benefit managers formulary as it stood. That formulary, however, is really designed to maximize rebates and maximize discounts off of a list price. It doesn't necessarily give you the lowest net cost or drive you towards the highest clinical value drug. But now that we have this change in our arrangement, we're actively and with the PBM, right, making adjustments to that standard formulary that prefer higher value drugs, right, to try to move our utilization over to drugs that sometimes cost less, and in fact sometimes we find ones that cost less and actually have higher clinical value as well. So it's really a win-win. And we're actively making those changes and asking the PBM to come forward and make recommendations on our behalf. They've been doing that, and at the same time, we have some outside advisors. We have a contracted entity who has expertise in comparative effectiveness research and looks at the highest clinical value drugs and helps us make formulary decisions. And then we also use Yukon Health to help us take a look at those recommendations and make sure they're the right ones and aren't going to have negative impacts as far as physicians are concerned.
Are there specific recommendations that you would make to the legislature that would empower you to help control the skyrocketing cost of drugs? You can say no. That may be a question for a different forum. Go in front of us, and I don't want to go afield of.
I think. Well, let me say this. I think some of the things that you were reviewing, I think, would be helpful in an aggregate basis, because one of the things that we are battling against is we are working from an environment and off of formulary construction that because of underlying incentives in the market drive and incent drug manufacturers to raise their prices, because it makes it easier for them to provide higher rebates. It makes it easier for them to provide bigger discounts. And if that environment didn't exist, we would likely have baseline drug costs that would be a little bit lower, and we would be less challenged in trying to make adjustments within this market to best align with the incentives of the payer, or best align with the incentives of the health plan, in a market where the incentives of many of the other players maybe don't align, right? So we're doing our best to try and create that alignment, but we're only one player in the market, right? And so the overall business practices, we're kind of fighting against.
Well, sounds like a conversation for another day, but we have some work to do to help you align those incentives. Thank you, Mr. Chair. Appreciate your time.
Thank you, Senator. Representative Corpus.
Thank you, Mr. Chairman. I had two questions on the OPEB benefits. Well, rather on the deficiency in general. This may be a freshman question, but order of magnitude, is this deficiency, I know it's greater than it has been in past years, but if you would say over the last 5 years, what has the deficiency in your area been, and how does this number compare to that at this particular point in the year, apples to apples?
we think this is similar. We would say this is in line with past years. You know, I guess these are volatile areas that fluctuate, you know, from year to year. So I don't think it's especially different from past years.
Thank you. And given the rise in health costs that we've been talking about here, have you done anything to change, and the anticipation that those will continue, have you done anything to change your forecasting models, whether it's your estimated costs or the discount rate you use to take the assets that we have back to the present day to figure out what our potential obligations over time might be?
So I think there's two areas where we have to use forecast models. So one is in our calculation of our OPEB liabilities. And relative to our calculation of our OPEB liabilities, we use the standard methodology that's required under GASB. So this GASB 74 and 75, I think, are the ones that are applicable here, but they sort of have recommended discount rates that are utilized, and those are leveraged. So that on that side, it's a little bit different than the pension side, where we're sort of making your own decisions as to how to do that. And so I just did want to highlight that. On projecting out our medical and prescription drug costs, you know, I think we unfortunately we actually tried to be quite conservative last year, and I was coming into this year when we set our rates. And to be honest, we didn't build in a significant amount of savings that we expected to get through some of our contractual arrangements to give us some buffer. So that, and I highlight that because that is something, you know, we are trying to be more conservative on. Unfortunately, the experience was so significantly out of the norm that it not only overextended, you know, our standard projections, but also ate through those savings as well, and you know, and ended up being much more significant than we would have expected. But yes, we will continue to look for opportunities to be more conservative, I think, on those projections, so that you know, at the end of the year, we're not coming back and asking for additional funds and you know, and creating challenges for the budget.
I have a follow-up question, Mr. Chair, but I can wait till the next round.
Thank you, ma'am. I appreciate that. Senator Summers is before you. She had her hand up and it's no longer up. Are there any other questions before I go to a second round, recognizing Representative Corpus for the second time, ma'am? Thank you.
This will be it. Again, relative to this projection, and I see it as relevant to what we're looking at today, because this deficiency bill is essentially a difference between the projection and where we are in the current year, which I understand is standard. But did we change our discount rate that we applied to project our future OPEB obligations over the long term? Because as we sit here in a fiscally difficult year with the guardrails by some under attack and potential, although I don't know if it's current yet, cuts at the federal level, I'm very concerned about you know, our projected liabilities relative to our actual liabilities. And I'm under the understanding from a report that was sent to me in early March that we did in fact change the discount rate outside of the FASB, or whatever the equivalent is, Rule 75, which decreased what we are holding our current OPEB liabilities at today. Are you familiar with what I'm talking about, and can you expound on it a little bit?
I am not, and I do apologize. So I think just generally what we use for our discount rate for OPEB is, so for the funds that we have in the OPEB account, which is about $3 billion, and is, you know, our total OPEB liabilities are around 18 billion. So there's $15 billion of unfunded liability. But for the $3 billion, we use the same discount rate that CSRS and TERS uses, right? So 6.9%. And then for the rest of it, we use what GASB recommends for a long-term rate, which is well, it's essentially a short-term rate, but it's something of a municipal bond rate. So it's not very aggressive. I guess it's a relatively conservative discount rate.
And if there's, is there someone in your organization who I could ask about that? in
Yeah, I think
particular?
what we could do, because to be honest, we use contracted actuaries, but we can take that question back and then and get a response for you.
Thank you very much.
That's fine. And thank you, Representative, and to the Comptroller's Office in terms of the OPEB rate. The big thing is that many employees have already completed their payments at that 10-year mark. So that is a big factor as to why that rate has changed over the last few years. And so that's just going to affect OPEB no matter what. So I'm sure that you'll see that in the answer that's provided to you by the Comptroller's Office, Representative. Thank you very much. We appreciate you guys, and you're good to go. Next up, we have the Department of Revenue Services. Morning, Commissioner. How are you? It's good to see you. Commissioner, we know that you have submitted testimony, so we're happy for you to reference that testimony and start off with any additional remarks, and then we'll move into questions from there. You have the floor. Please be sure to state your name for the record, sir, although we all know who you are. Thank you.
The deficiency appropriations for fiscal year ending June 20th, 2025. June 30th, 2025, excuse me. You have my testimony already in front of you, so I won't restate all of that. I will say a couple important points about DRS so that you're all aware of them. One is that in the biennium budget, we were appropriated $61 million. We'll close this year spending about $51 million. So I run the agency on about $10 million less than what you appropriated towards us. We did that through finding efficiencies, working very hard and cross-training many of our employees and being able to utilize a lot of the new digital technology that we've been able to incorporate within our programming. Having said all that, we are asking for a restoration of approximately $540,000, which I wish it was $540 million, but it's not. It's $540,000, which will be restored to help us make us level at the end of this fiscal year. So with that, that's why we're here today. We get a little bit of money back, which will help bring us back to balance for the year. But in terms of saving dollars and making our contributions to what has been admittedly by everybody a very difficult, challenging, whatever adjective you want to use, fiscal year, we think we've certainly stepped up to the plate.
Thank you, Commissioner. And if you could start us off by just walking us through the process of how you believe that DRS, how this bill would specifically impact revenue for the state, both in the short and long-term futures. That would be helpful for us to understand as we go through the rest of the questions.
Well, with restoration of this money, which is really what we're asking for in the bill, we'll be able to fill out and hire several key senior positions that have left. And we do anticipate more separations of employment after July 1. We've gotten letters from folks who have been kind enough to notify us to say, hey, start planning, because I'm out of here after 36 years or 37 years. And we're happy for them. But we're sad because, because it has a huge impact on our agency. So last summer, when we had the retirement wave coming, we took that as an opportunity to reduce our overall staffing through a reorganization. We're still in the process of reorganizing. In order to do that, they're not new positions to the agency, but I guess they're redefined positions that require us to fill them. So some of this money will allow us to go forward with those appointments. A key one would be in our appellate division, where we're been able to bring in a manager that'll help manage the workflow of many of the appellate cases. So we have a senior attorney at the top. Then she'll have a manager underneath her that'll help work with all of our other attorneys to prioritize what's the easy ones. Let's get them out of here. What are the more difficult appeals that we have going on, and how do we manage that, and where are we going in terms of legal strategies? So that would be an example of why we would need some of this money restored.
Thank you, Commissioner. I appreciate that. Representative Nuccio, ma'am.
Thank you, Mr. Chair, and good morning, Commissioner. I just want a really quick question. So basically, you had indicated that you're running pretty much 10 million under original budget. This is just a reinstatement of the money that has been moved through FAC or some other prior action? Okay, all right, that's all I wanted to be sure of. Thank you so much.
Thank you, Representative. Short and sweet. We appreciate that. Any other questions from the committee? Representative Nolan.
How you doing, sir? Thank you for coming before us. In regards to compliance and enforcement, what strategies does DRS plan to employ to insurance compliance with new regulations proposed in HB 6863?
Commissioner, I think you need to turn on your microphone. Sorry about that.
Not familiar with that particular bill and what the requirements are, but I will tell you that anytime new legislation is proposed that has DRS doing new stuff, and we have a lot of proposals out there in this session that have taken us out of our lane or having us do things that we've never done before. I think that's a real compliment to the agency. It says, hey, DRS can probably figure this out. Let's throw it to them and get them working on it. But the challenge for us is that oftentimes we're taking folks that are doing compliance or are doing enforcement or even doing audits of current taxpayers and putting them on projects that are out of our core mission, projects that are out of our core mission. So that's a real challenge for us. So if the legislature deems as a policy decision to add new programs, we certainly ask that they add new staff to be able to go along with that. I think that's only fair.
Okay. It just HB 6863 is the bill we're talking about now. It's the deficiency bill.
Oh, sure.
Just so you know. In regards to like economic impact, has DRS conducted any analysis on how the deficiency bill might affect local businesses and taxpayers?
Well, I think we're running about 70 positions right now that are unfilled, that we hope to be able to fill after July 1. That does impact enforcement. That impacts communications. That impacts guidance that we put out for business owners to, this is how you do this, this is how you do that. The more feet we can get in the street, if you will, that can sit down with the business owner and walk them through how to sign on to MyConnect or how to be able to use some of the tools that we have there, the better off we all are. We'll get better compliance. And in the end, we just want people to comply. We're not looking to conduct enforcement actions. We're looking to conduct compliant actions. So when you have a loss of staff like that, that hurts. And I think over the summer, we've been, like I said, we've been noticed that there'll be significant amount of senior staff that are taking their much earned retirement. If we don't get to fill those positions, that it'll be impactful.
Okay. And Mr. Chair, if someone else has a question, or I can ask another one, it's up to you.
They do, Representative, so we'll come back to you, Representative Baker, for the first time.
Thank you, Mr. Chair. Question in regards to the convenience fee. Have you set are you still establishing an amount for the convenience fee for electronic payments, and how will those fees be applied to your department?
Credit cards. Yeah. I'm assuming you're talking about credit card fee.
Yes.
Yep, Commissioner Biel.
So I'll take that one. Good morning, everyone. And Representative, the way we handle credit card payments at DRS is a little different than what other agencies currently experience. We do not charge a convenience fee for paying any tax liability through credit card. We have partnered with a credit card processor for a number of years now. And the way the transaction works is if a taxpayer wants to go and pay their tax liability through credit card, they would do so through this third-party processor. And any fees that are imposed by that processor. And the taxpayer agrees to pay that fee to the processor. DRS never collects any convenience fee. We don't have anything to do with it. We get the settlement from the credit card processor for the tax liability only. So I hope that answers your question. We don't We have no way, in no way do we involve ourselves with any convenience fee for credit card processing.
So if there's a penalty, or a late, tax penalty, and stuff, though, that'll be part of the actual, payment. And that, all of that will be forwarded over to DRS. Is that correct?
That is absolutely correct. The tax liability, if the payment is late, there would be interest and a penalty could also be imposed. That entire amount, without the convenience fee that the processor charges, will be forwarded over to DRS.
Okay. All right. Thank you. I appreciate your answer. Thank you, Mr. Chair.
Thank you, Representative Baker. Are there any other questions for the first time, either online from the committee or in the room? Seeing none, Representative Nolan, you have the floor for the second time, sir.
Thank you, Mr. Chair. And I'm just curious, what will DRS be doing to inform taxpayers of the changes in regards to the deficiency bill?
In regards to
The deficiency.
the deficiency.
Yeah.
By the way, I want to apologize. My notes say 5863, so I'm sorry about that. Not getting the bill number right. My apologies, Representative. Generally speaking, we're not going to see much change to June 30th in terms of our collection efforts and our filing process with this money that we're asking to be restored. So not sure that we really have to do much communication, but anytime there's a change to the tax code vis-a-vis the work done by you all, we do notify all of our practitioners through email blasts. We post the guidance up on our website. We sometimes will have webinars as well that will go along with that. And we do meet with community agencies, churches, senior centers, those kinds of organizations to explain what some of the changes are. But right now, with this current bill that's before us, we don't really anticipate any notification will be necessary. People won't notice. It'll be seamless. They're not going to notice really any impact.
Okay. Can I squeeze one more question in there, sir?
Just because Austin isn't here doesn't mean that you're gonna run
Yes.
rampant. That's my neck on the line when it's all said and done. Representative, I will grant you one more question. Go ahead,
So
Representative.
since she's not here, this smiles for her. No. How does DRS plan to collaborate with other state agencies to ensure the successful implementation of the deficiency bill?
We have embarked on several new collaboration efforts that I think the committee might be interested in. One is that we work with our state police team and Department of Consumer Protection. We have a joint, for lack of a better term, task force that goes out into the community. We meet with the local mayor and their zoning enforcement folks, and we all go out as a group together, and we conduct inspections of various businesses that, for example, looking for cigarettes that don't have the right stamp on them, or folks that might be selling cannabis without the proper licenses. But we've wrapped in all the teams within the state as well as the local teams together, because oftentimes they're associated with quality of life issues for those neighborhoods that those businesses are. And that's something new and has required a lot of collaboration with our enforcement teams. Deficiency won't impact that. We've done sort of a beta test now in Waterbury, Stanford, and New Haven, and some other places that we're looking at right now. We're going to continue to do that. We'll ramp that up throughout the year. But again, long-term, in terms of hiring, we'll have to look in terms of whether we can sustain those programs over the longer period. So in the short term, not much.
Thank you, sir. And I just want to say publicly, Senator Osteen, I take that smile back in case you're watching. Thank you, Mr. Chair.
Thank you, Commissioner. It's probably best that you leave now before Representative Nolan loses his seat. Thank you very much for your testimony and for your hard work. We appreciate it. Next up, we have the Department of Veteran Affairs. Commissioner Welch, would you join us, and we'll get started.
Start again. Good morning, Commissioner Ron Welch, Department of Veterans Affairs. to Representative Paris and all of the esteemed members of the Appropriations Committee. We appreciate the opportunity to submit the testimony that we provided you today to speak about Connecticut Department of Veterans Affairs deficit mitigation request. Department of Veterans Affairs respectfully requests $625,000 to mitigate a deficit in our other expense account. The deficit in the other expense account is primarily due to significant cost increase in 4 areas: food, energy, medical supplies, and pharmaceutical. Additionally, our institutional general welfare fund, which has been for the past 10 years used to supplement our other expense account, reached insolvency. The agency continues to work to find ways to achieve savings and utilize our funds in the most efficient and effective manner. While the original deficiency bill identified a shortfall in our personal services account of $133,426, we have since identified a lapse of $375,000 and are no longer anticipating a deficit in this account. We thank you for your time today and your service, and we're ready to take your questions.
Thank you, Commissioner, for that quick overview and summary. Are there any questions from committee members? I'll start with one, good sir. First question I have for you is just with what specific factors contributed to the department's budgetary shortfall that's been addressed in the deficiency bill? If possible?
Great question. And, the key thing is we had the institutional general welfare fund. Going back to around 2015, there was as much as 10 million in that account. So we've had to constantly spend down over the last several years. And right now it's basically depleted.
And just a follow-up to that, what steps have you all taken to fully and further manage and or reduce the impact of the financial deficiency? What mitigation plans have you had in place?
Well, overall, we try to reduce our overtime from a PS perspective. And also we had several vacancies that we are working very closely with our HR partner to go ahead and fill those vacancies. A big initiative in terms of the energy side of it, as Deputy Commissioner a couple years ago leaned forward and got going on a solar farm, which we will have on our campus within the next couple of years. So that should help us on the energy costs. The pharmaceutical side of things, big surprise from the federal VA, anybody under our custodial care now, we have to provide pharmaceutical reimbursement to the federal VA. So that's going to be, it is a significant impact and will be in the future years. By 2027, we have to have on board another pharmacist and a pharmaceutical tech to make sure we can fill all the scripts that are required.
Thank you, Commissioner. Any further questions? Oh, look at that. Representative Ackard, followed by Representative Corpus, followed by Representative Nolan, and I think quite possibly Representative Cabros DeGraw.
I didn't mean to start some snow falling here, but
Wow.
thank you, General. Good to see you. Can you,
Good to see you.
the Institutional General Welfare Fund, you said it's now insolvent. So is that an odd question, but is that a necessary fund that you use for the welfare, or what is that fund?
Those funds, the revenue stream from going into that fund is from our residents that have to pay 25% of their disposable income in our residential program.
So they pay, so your residents pay into the fund?
Correct.
Okay, and now, but the fund typically is used for?
All those other expenses that are not covered by our traditional operating budget, which has been about $3 million since around 2015. It's been relatively flat since 2015.
Now, the residents will still pay into that fund, or that fund is non-existent?
Yes, it's still in existence.
Thank you. Thank you, General.
Yeah.
Thank you, Mr. Chairman.
Thank you, and thank you for your testimony. Is it the case that for this fiscal year, which ends July 1st, 2025, that the the deficiency is completely unrelated to any federal money that the Department of Veterans Affairs was expecting. We're in this exercise of trying to figure out if in fact the state is stepping in where federal monies have exited. That's why I really want to know, it seems from your testimony that Veterans Affairs is sort of good through fiscal 25. And while there may be something on the horizon as we sit here today on April 10th, we don't have a number for that. Is that right?
Yes, no direct impact yet with what we've heard at the federal level. We do have, about 12 big projects that are could receive some federal reimbursement. Of course, Medicare and Medicaid, we get a lot of federal reimbursement for our residents in both the skilled care facility and the residential program. So we're monitoring it every single day. We provided some comments for the governor last Friday on this topic, and we're just keeping a very close handle on what's going on.
Thank you.
Thank you, Representative. Representative Nolan.
Well, thank you, Mr. Chair. Good morning,
morning.
Commissioner and friends. First, thank you for your service.
Thank you.
And thank you for what you continually do for our veterans. It is greatly appreciated. So I'm just interested in seeing if you would share how the deficiency affects the department's ability to deliver services to our veterans.
So we really need this $650,000 in a big way. As you know, it's a 24-hour operation. We can never take our eye off the ball. They're all under our custodial care. We need, everybody knows the significant increases in food costs and energy and the pharmaceutical side. So it'll have a major impact if we are not able to move forward and get this, the 650,000.
And the other question, I got three, but I'm going to ask two first. The other question is, can you just share what measures are being implemented to prevent similar budget shortfalls in the future?
I say that we have a very nimble staff. We do the best we can, again, with the 24-hour operation. We are constantly looking for ways to trim down and become more efficient. There's always room for improvement. We typically have about 30 vacancies out of 241 that we're required to have. And then we have part-time members also on our staff. We're doing, I want to say, the best we can at this point.
Thank you, Mr. Chair. I'll wait for you to give me the next question.
That's at the discretion of the chair, Representative, so you might want to pray instead. Representative Cavros DeGraw, you have the floor, ma'am.
Thank you so much, Mr. Chair, and apologies that my camera does not seem to be working today, but I do appreciate the opportunity to be able to ask a question. Thank you so much, Commissioner and staff, for being here. We greatly and deeply appreciate all that you do for veterans. Is the department seeking additional funding sources or reallocating existing resources to try to address the deficiency initially?
We work very close with budget analysts from OPM pretty much every day. So we have looked at all of our other accounts and tried to reconcile things.
Okay, we understand. And with the chair's permission, one more question.
Permission granted, Representative. Thank you.
Thank you. Thank you so much. Has the department coordinated with other state agencies to address that financial shortfall or to perhaps find a way to share resources?
Good morning, Representative Deputy Commissioner Joe DeNeo, and absolutely always working with other state agencies, DAS, OPM, DEEP, and we've been very successful in partnering with them, including Connecticut Green Bank, and really going on the attack on our consumption of energy across the campus. We just finished up a lighting project. It replaced over 8,000 light bulbs on the campus. So the last two electrical bills, we've seen the consumption start going down as on the electrical side, and we have other projects staged to begin very shortly. And a very large project is our boiler installation, 2 boilers that are really going to drive down our natural gas consumption. So hopefully those will pay off and start providing some room in the operating expense budget.
But without partnering with other state agencies, they wouldn't be possible. So we appreciate being able to do that and our own bond dollars that we've been able to obtain allocations on through the bonding subcommittee. We've also put those to work too. So everything we're trying to do now is just to stage and completing those projects to yield savings in our operating expense budget and to meet Executive Order 1 reduction in greenhouse gas goals.
I really appreciate hearing that as someone who works on the state plan of conservation and development, which, you know, is part of its goal is actually to work across agencies like that. So you are a model for others, and I really appreciate hearing that. And thank you so much, Mr. Chair.
Thank you, Representative Cabarrus DeGraw. Any other first-time questions coming from members in the room or online? Representative Nolan, for the second time, sir, you have the floor.
I just so appreciate you today. Commissioner, I know the importance of, but can you just give a little view of the Veterans Opportunity Pilot and how well and what things you're doing to help our veterans in that area?
You're talking about just the wraparound services that are provided. So, you know, in summary, 125 skilled care facility, excellent care is provided there. In the residential program, we received some ARPA funding. A lot of you know, all of you are aware of that. So we're expanding the housing part of things. We have 5 residential houses across the street. We're adding 6 more on the main campus, and on the top of the campus, another 6 plus individual apartments. So at the end of the day, we'll be expanding by close to 60 spaces. The low number is about 45. The higher number is close to 60, depending on how we do this. But our real goal is to, when somebody is assessed into the programs, to be able to provide wraparound services. And it starts right with the intake. Identify exactly where that person is. What do they need? Do they need help with substance? Do they need employment? Do they need behavioral health? Sometimes they need all of it. So instead of having them institutionalized and staying there for years, we're really trying to do a great intake when they first come into the program and provide those wraparound services and get them re-employed if possible, and get them to live independently and live the best life they can.
Thank you. And I just really think that it's real important that that service is available for our veterans, because it helps them from the start and it continues all the way through to whether or not they go in out on their own or they have to just stay for continual care, a continuum of care. So I really am supportive of, you know, trying to get the funding that you need for this. Thank you very much. Have a nice day.
Thank you.
Thank you, Mr. Chair.
Thank you, Representative. Thank you, Commissioner, for all of your hard work. We appreciate your efforts, and we look forward to working with you in the very near future. Thank you.
We
Next up, we have the
everything that everybody does, and so thank you for your service also.
Of course.
Have a great day.
My apologies. Next up, we have the Department of Administrative Services. Commissioner, good to see you.
Good morning. Good to see you as well.
Thank you. Would
so
you
much
mind
for-
introducing your staff for us as they, for the record, and then you can move straight into your comments and testimony now.
Absolutely.
Thank you.
To the Appropriations Committee, including Senator Aston, Representative Walker, Senator Summers, Representative Nuccio, and to all of the committee. I'm Michelle Gilman, the Commissioner of the Department of Administrative Services, here to speak before you on an act making deficiency appropriations for the fiscal year ending June 30th, 2025. Known as House Bill 6863. And I'm joined by Erica Jaquilla, who is our Chief Financial Officer at DAS. She may be new to the committee. She has been with DAS since December, but she's not new to state government, so pleased to have her with me today. And then also joined by Lisa Annis, who is an HR administrator under the statewide HR for DAS. Lisa has also served the state for many years as well, and just took over just last week our workers' comp portfolio, in addition to the benefits and leaves portfolio that she's managed for several years. So again, pleased to welcome them before the committee as well. So I'll just give a brief overview, as I do know that you have our testimony. The personal services account for DAS does have a shortfall in the amount of $4.5 million due to several factors. We have been working over the last year, actually about a year and a half or so, to contain that deficit through managing very tightly our vacancies, looking at holding on promotional opportunities where feasible, unfortunately, looking at restricting our TWRs and through other means, but certainly looking to fill those positions that are most critical, where it would jeopardize safety for our workers, customers, or the public, would disrupt government operations, or increase risk of damage to structures, security, in particular in our IT infrastructure. So we continue to take those steps through the course of the end of the fiscal year, and certainly will look to do so in the ensuing fiscal years ahead. On the OE side, we do experience a $1 million OE shortfall, primarily due to contractual obligations associated with owning and maintaining our DAS-owned facilities. DAS does own about 10% of the state's property portfolio, and similar to other agencies and other entities across the state, we are seeing continued inflation and increases in utilities, including electricity, water, sewer, natural gas, and oil. And then certainly the repairs and services and supplies that we need to maintain that facility, those facilities and those premises have also increased as we've seen over this past fiscal year. So we'll continue to monitor those expenses, and certainly defer any requisitions or payments on those expenses through the end of the fiscal year as possible. Lastly, on our workers' comp fund, we are experiencing a $562,120 deficit in the general fund for workers' compensation administrator account. And this is as we negotiated a new negotiated contract with our third-party administrator. We did see an increase in that contract. And so the proposed adjustment would help mitigate the deficit we're seeing for that expense today. And then on workers' compensation claims, we are seeing a net lapse of $1.2 million overall, but you will see shortfalls in the DOC, DEMIS, and Yukon line items, which are again offset by forecasted lapse in the other accounts. I will make a note as well that our special transportation fund does have a $1.5 million shortfall due to some increasing medical and indemnity costs, rising medical expenses and other factors. There's a DOT claim as well that accounted for about $300,000 of that total shortfall. So that's a summary of our deficiency items before you today, and we're happy to answer any questions that you may have.
Thank you.
Again.
And before we go straight out to questions, I'd just like to start off with asking for a quick summary, Commissioner, if you can, explaining to the committee essentially what primary factors led to the budgetary deficiencies for DAS. And then in addition to that, my second question will be how have these shortfalls affected your ability to deliver services and fulfill the mandates that you need to fulfill?
Certainly. Thank you for the question, Representative. The primary reason behind our PS deficiency are really around the contractual obligations, referencing the step increases and the COLA increases that were scheduled primarily in fiscal year 2025. Those are obviously contractual obligations that we have primarily within our unionized workforce and primarily within our IT or P4 bargaining workforce, but it really is attributed through DAS overall. And so those obligations were important and necessary to ensure commitment to. And that is really behind primarily the $4.5 million deficiency that you're seeing here today. We also had some larger than normal accumulated leave payouts as we had some high value retirements or other leaves in the agency this past year.
Thank you. I appreciate that. We have first Representative Cabros DeGraw, followed by Representative Nolan. Let's get him out of the way. Representative Ackard, Representative Nuccio, and Representative Corpus in that order. Is that all right?
I think that means I'm first.
Yes, thank you.
Thank you so much, Mr. Chair. It's lovely to see you there. Again, apologies, my camera's not working. My question is similar to the one that I had for the last group. What strategies or initiatives has DAS been implementing to mitigate these deficiencies and manage resources more effectively?
Thank you. Thank you for the question, Representative. So we've taken a number of steps, over the last year and a half. We've had I'll say a hiring pause. We certainly have not frozen recruitments at the agency, but we have taken a very deep dive into where our recruitments needed to be done on a most critical path. Where we could defer or hold some of those vacancies, and where we had attrition, where we may be able to release a position or others and not recruit for the future. We have also, unfortunately held on some promotional opportunities to try to see some, cost benefit. But that has been challenging for our agency and for our team, a team that works really hard to support our other agencies across the state and constituents and residents across the state as well to provide a number of critical services. But we have done that work. We've also, besides one individual that we had within the agency, not brought on TWRs through our agency to eliminate that additional cost as well. And then we're really looking at our attrition rates through retirements and others, and then looking at utilizing trainees, trainee roles and other lower level positions when we do have attrition based on retirement, and looking at that lower level classification to bring our employees in so that we bring those opportunities into DAS and refill a position, but perhaps at a lower level than the previous incumbent who may have left. I will also say that when we look at some of our inspection areas, whether it's our elevator inspections, our fire marshal inspection teams, building officials, and other areas within our DAS team, we're looking at technology and where we can do virtual inspections, where that may be an option to help save our staff from being on the road, to helping them be more efficient with their time. And it also helps the clients and customers on the other end. So that is rolling out. We're not quite there yet in terms of 100% efficiency, but where it's effective and safe and an option, we're deploying technology, and that's an example of where that can be effective. I will say our HR team, as our state employee workforce, has seen some growth over the last few years due to federal resources and other factors. Our HR team has maintained its size. And so we're really proud of the efficiencies that our HR team has seen in terms of managing our workforce through technology and working together across agency teams to ensure those efficiencies. So as we've seen growth, we've been able to manage with the existing workforce within the HR team and not grown accordingly. Our IT teams are working very efficiently as well, cross-agency and cross-team work when we're looking at cybersecurity, when we're looking at AI implementation, when we're looking at cross-functional needs across agencies and how we can deploy different technologies across different agencies, really maximizing those cross-functional teams within our IT structures to ensure we're maximizing that participation. I will say it's challenging given some of the work that we're doing within our business office, within our HR team, and supporting not just DAS, but our other smaller agencies in that work. We're again trying to maximize our resources as best as we can. And so we hope to continue to do that again through the end of this fiscal year and beyond.
Thank you so much. That was a great explanation, and I certainly appreciate that you are trying to do more with less. And I think that it's something that certainly our constituents and taxpayers would appreciate as well. And I think you started to lead into this, but with the chair's indulgence, the second part of the question would be, what steps are you taking to prevent similar budgetary issues? I think you were starting to go there, but if you have more to say, that would be great.
Yeah, so what we've asked all of our senior leadership and right down to the line leadership as well, or our line workers, is to continue to look for those efficiencies in processes, whether it's identifying new technologies that can allow us to scan files rather than having paper files and creating, additional processes there. How we can use technology and more digital assets to schedule events or schedule inspections or, share information. So utilizing that technology, but utilizing it wisely. We know that we need people behind the scenes to do a function, but where we can utilize technology to help support an employee and allow them to dig into the complex work that we have is an efficient use of our resources. And so we continue to look every day at how technology can benefit us at DAS, but also help to support our agency partners in the work that they do.
Thank you so much. Really appreciate the responses. Thank you, Mr. Chair.
Thank you, Representative Nolan.
Thank you, Mr. Chair. First, I want to thank you for being on my podcast, Rolling with Rep Nolan. I have to give that,
I look forward to it.
Excuse me, Representative, it's not relevant to the bill before us. Please do not mention any podcasts and please refrain from doing that.
Okay, sir.
Thank you, sir.
So, good morning again.
Good morning.
Could you share if there are any legislative actions or support that DAS believes would assist in resolving the deficiencies or enhancing operational efficiency?
Thank you for the question. So I believe in the governor's proposed budget, that budget will make DAS whole, so to speak, in terms of not only let me back up. The deficiency bill certainly will make us whole for this fiscal year. And then moving forward, the governor's proposed budget will make us whole for the future in terms of these future obligations and then some of the other costs that we're seeing on the OE side around electricity costs and maintenance costs and others. So appreciate your continued review of the governor's proposed budget for DAS. And then our commitment to you is to continue to look at how we can use virtual technologies, other technologies to continue to support the work that we do. And again, to utilize cross-training within our business services team, look at opportunities to reorganize as we've done within our benefits and leave and workers' compensation team to maximize those opportunities for cross-training and for some reorganization opportunities as well.
Great. And the next question is, has DAS explored partnerships with other state agencies or private entities to address these financial challenges to improve the services?
We do. And part of the work that I enjoy the most at DAS is that ability to partner with our other agencies. Oftentimes it is our agency providing those services or supporting our other agencies with a function or an initiative. And we're statutorily mandated to do as such. But where an agency has an opportunity or an efficiency to provide a service, and where we have an idea to do that service better, I think that's an opportunity that we all have to listen and to look at how we can replicate that through all of our agencies, whether it's DAS or others. But we're really pleased at DAS to be able to support our other agencies, whether it's with HR functions, with IT, certainly with our real estate and construction teams on the fleet side, with any building maintenance that's required, security and safety, and also procurement. We have, I think, well over 200 contracts plus that we're currently managing for our state partner agencies. And my procurement team is probably watching now, and I've probably given the wrong number, but that number changes daily in terms of the goods, services, and products that we're procuring for our agencies at any given time.
Thank you, ma'am.
Thank
You
you.
have a good day.
You too as well. Thank you.
Thank you, Mr. Chair.
Moving on, Representative Nuccio, Representative Ackard, Representative Corpus, and Representative Baker.
Thank you, sir. You didn't have to jump me to the front. I appreciate that, though.
Thank you.
Commissioner, thank you for coming. I have a question in regard to, I'm doing a look back at actuals and such, and in prior years, the organization had about an $8 million lapse. That was a pretty solid number for like the last 5 years. And this year you're projecting a deficiency. And in looking at the OFA expenditure detail, I noticed that there are reductions to your budget. And it looks like, that number kind of was adjusted for that 8 million-ish number in the prior budget. So do you feel like part of the reason here for this deficiency is because of the basis of other FAC actions that have moved money out of the organization, or maybe they cut too deep in that area and that's part of the problem?
I'll likely defer to my CFO, Erica Jaquilla, on that question. I will say that, again, we recognize that the deficiency on the PS side is largely due to those contractual obligations and then some of the hiring that we've needed to do for those critical roles. While that deficiency I do want to identify has also been stable throughout the last year and a half. We've been able to maintain that at about that $4.5 million level. But I'll defer to Erica on the deeper question.
Thank you. Since I am, new to the agency this year, I would have to dig back into prior year FACs to get a better answer for you. So if you don't mind, I'd like to take that back to my team to get you a full answer.
That's fine. That's
Thank
fine.
you.
I'm just looking back, like I said, I'm doing a deeper dive of the actuals over the years and that. And it's just, this organization has had a pretty steady lapse, but there was adjustments made to this year's budget coming in, and the FAC movement that I'm seeing, we're seeing a lot of money being taken from one area to give to another area, but sometimes in doing that, we're actually creating the deficiencies, right? So I just wanted you guys to have an opportunity to either refute that or say that, yes, either way, again, I understand you had a decrease in open heads from prior year to this year, so the hiring up and that makes sense, but I'm just really trying to understand the movement between the FAC actions and where we currently are today. So if you can get back to me with that information, I would greatly appreciate it.
Thank you.
Thank you.
Thank you, Representative. Representative Ackard.
Thank you, Mr. Chair, and Commissioner, thank you for being here and fielding these questions. Just a question on the inspector side. Do you have openings now? Just a background, I'm in the trades and I've reached out to the state inspectors and they are fantastic at returning emails, by the way. So, and
Thank you.
responding to the questions. So kudos to their efforts. Where do we stand, not just in the trade inspectors, but you mentioned elevators, fire safety. How do you stand in terms of any openings in there?
Certainly. Thank you for the question. So that entire inspection area has been under our critical vacancy path since my tenure in this role. So whether it's our boiler inspection team, our elevator inspection team, fire marshals, or our building inspectors, my commitment has been to ensure that we have a full complement of staff working in those various roles. We also have a training team referred to as our ODM team that provides training not only to our internal team, but also to firefighters, fire marshals, building inspectors, and others throughout the state on those roles. And so those are just a few of the positions that have been really critical for us to ensure are filled. The ODM side of the house is paid through a revolving fund. So I do want to clarify that. But those other general fund positions do have some occasional vacancies due to attrition. They are generally fully staffed teams at this point. We are working with OPM on 1 or 2 vacancies that may exist in those teams at this time. And so that does happen, again, as there are retirements or folks leave, for other opportunities. So I would have to get back to you on the specifics of the vacancies that we have in those teams at this point. But in general, we've been working very well with OPM to ensure a full complement of staff to ensure especially the safety of boilers across the state, elevator inspections and the like. We did have some elevator inspection backlog following the COVID pandemic when buildings were closed. We at that time also to catch up on that backlog brought on a third-party vendor, which we are no longer using. That was our goal and our commitment to our union partners as well to ensure that our state employees were doing those inspections. And we believe that is the safest course of business as well when we're doing those inspections.
Thank you for that answer and a follow-up to that, Mr. Chairman.
Yes, sir.
So that's not an area that we are looking to. When you mention, I don't want to say not fill, but analyze that, that's not a need area. And you did mention, and to piggyback on that, the use of technology. I can tell you that during COVID, I had to walk around my job sites with local inspectors and literally videotape and do the work because they weren't leaving the office, obviously, at that time frame. So technology could play an important part in that, as long as it doesn't provide, there's not a safety component that we'd be lacking on. So if you want to elaborate on that, you're looking at technology and making sure that those roles aren't the ones that we're looking at not filling.
Correct. So again, we have ensured that we have a full complement of staff and filled all of our vacancies for those respective inspector teams. With respect to the use of technology, our building inspector team, I think is a little farther ahead than our fire inspector team on utilizing that virtual technology. But we're working to maximize that where we can. Again, I think each situation you need to assess the site, what is under inspection, and then if it's appropriate from a safety perspective or what other factors are involved for that virtual inspection. But that will absolutely save vehicle time, travel time, the inspector's time to be able to do more inspections. And again, potentially on the customer side to help maximize their time too. So we are looking at all of those technologies as options. It's not an immediate fix for us and certainly not holistic fix for all inspections, but that is where we have opportunities to engage. Similarly, on our training under ODM, we offer a complement of virtual training and learning opportunities for our customers in fire and building inspection. But oftentimes those constituencies want and crave those in-person experiences as well. So whether we're offering night trainings, weekend trainings and the like, we are trying to be flexible with offering that in-person or hybrid experience as well. But those are all opportunities that we look at every day when it comes to scheduling and how to best serve our clients, but also maximize our staff resources.
Thank you, Commissioner. Thank you, Mr. Chairman.
Thank you, Representative. Representative Corpus.
Thank you, Mr. Chair, and thank you for your testimonies. This strikes me as a very well-run department. So thank you for all the things that you do. As you look at your 2025 budget, is there any change in federal funding that's impacting you through the rest of this fiscal year? I didn't hear any in your testimony. That's number one. And number two, is there a zero now in one of your line items for planning for 26 where there used to be federal funding?
Thank you so much for that question. It's obviously very timely, and I appreciate as well the compliment to the agency. I am only as good as the team here and behind me and at the agency. So I am grateful to them every day for the work that they do largely behind the scenes. In terms of federal funds, and Erica can speak far better than I, we are monitoring the situation for DAS in particular, but also working with our other agency partners in the governor's office and OPM. We have gotten notification that several grants we were hoping to get have been terminated. So it's not a loss of funds, but a disappointment to us about the potential that those grants could have had for us. We do have a digital equity grant that was awarded to us through the Department of Commerce that continues to, that funding is with us and something we are executing on, and certainly working with our federal partners. There are some staff paid through that fund, and we're monitoring, again, the status of that fund carefully. It has more of an impact on our communities and helping to ensure that residents have the education, training, and devices needed to work and grow and educate themselves in our economy. But other aspects of the federal funding losses that we may be experiencing in the state of Connecticut would be tied potentially to our infrastructure IT teams, where they are often paid for in part or in full by federal funds. So some of our federal agencies at DSS, DOL, DMIS, and others, where they may experience federal cuts, our IT staff are often paid through those same federal funds. So we're evaluating the impact of those federal funds, in particular to our BITS or our IT team now. And Eric, I don't know if you want to add to that.
I think really you've covered most of it. The
Okay.
fact that we really don't have any grants, federal grants currently that are going to affect our bottom line, because they were just going to be added perks to the agency. So we never had them before, so we should be able to move forward fine at this point.
Does that cover 25 and 26? Or are you speaking only for fiscal year 25?
Oh, no, for 26 as well. Yeah, DAS doesn't typically have federal grants. So it would have just been another perk leading into 2026 for additional opportunities.
Well, we're here to support should that happen. So thank you.
Thank you.
Thank you, Representative. Representative Baker, followed by Representative Reyes. Representative Baker, I think you're on mute, sir.
Oh, I'm sorry. I'm sorry, Mr. Chair. I apologize. Good morning, Commissioner. I know when we met last month in regards to discussing the budget in the subcommittee, and I'm just kind of taken back a little bit about the additionals on the personal services of 1.4, and also can you in my notes there wasn't any kind of indication that that this number that was that the governor's recommended number, and also what was given from the subcommittee. I'm just kind of curious where this additional request is coming in from. Can you elaborate a little bit more? Because I know we did give some additional costs from 2024-25. So can you elaborate a little bit?
Certainly. So just to clarify, you're looking for additional clarification around the 4.
Personal services.
And what led to that deficiency?
Mm-hmm.
Okay. So I'll give additional detail with respect to our BITS or IT team, which is about 500 or so members of our 1,200 employees within our organization. The P4 contract had various contractual obligations relative to steps within the contract and COLA increases. And then post-COVID, when we had some significant shortfalls in our IT team, and we were permitted to hire at various higher steps for those vacancies. And again, the IT teams were one of 3 or 4 identified sectors where we recognize statewide the value of an IT professional and trying to align our salaries with private sector, that those step increases had a higher value oftentimes and impacted our budget as we brought new staff in and brought them in at a higher level. And so again, that recruitment phase of bringing in IT staff at a competitive rate, along with the retirement tsunami, I think led in part to the deficiency that you're seeing today. In order to recruit the IT staff that we needed at that time of the silver tsunami, and recruiting high value expertise at that time did cost the state additional dollars that were perhaps not budgeted for fully. And so I think that's what's really leading to this larger deficiency than was anticipated.
So is that for personal services and a combination of expenses?
Yes.
Deficient?
Yes, and then we did have, some high value, high level employees that also retired. And so those payouts for, leave and retirement payouts were also very high as well. And so there were a number of contributing factors coming from the retirement tsunami in coming into this past fiscal year that led to our own bit of tsunami at DAS when we look at our PS line. And so again, I think between the potential action that the Appropriations Committee takes through this bill and then through the governor's proposed budget, that will ensure that DAS is made whole, so to speak, for future years. And then we'll, again, be able to sort of be on a reset moment, taking into account those various contractual obligations, our hiring, and I think we're on a much better path for stability in the future.
So, do these deficiencies with these new hires, do these have anything to do with your IT consolidation, with hiring on some of these new employees to kind of like accommodate some of the technology with this IT consolidation?
So when we have vacancies in our IT team, we are looking at various levels of an IT trainee or an ITA one, some of those lower levels of IT staff that we can bring in, at the first level or a trainee level to help alleviate the impact to our PS line. Oftentimes, however, we do need a higher level skill set to help us implement some of these higher level needs and implementations, or to help support another agency in their IT function. So with Mark Raymond, our CIO, very carefully monitoring our IT staffing, looking at cross-training, looking at how we can support agencies, and their various needs. We are looking at that every day in terms of how we can be planful for our recruitments and attritions as they may happen, and staying within our budget.
So right now, how many vacancies do you have?
Representative Baker, if you don't mind, would you mind letting other reps go first?
Okay, all right, no problem. So just one more. Can you give a breakdown of all the new hirings that you're doing, and then I'll save another question for the next go around. Thank you, Mr. Chair. I apologize.
That's okay, sir. So we will get the breakdown on the hiring for you, and that will be sent to the committee. I'm going to head over to Representative Kennedy for her first question. And then if there are no other questions, Representative Baker, I'll come back to you and indulge you for the second time, sir. Thank you, Representative Kennedy.
Thank you, Mr. Chairman. And thank you, Commissioner, for being here, and thank you for your written testimony. It's wonderful to see this amazing power team before us today. I have to make that comment. So thank you. And I'm looking at your testimony, and in the Special Transportation Fund, it shows a $1.5 million shortfall. And you state that what that refers to, but my particular question is, if you could just elaborate on it, is the 1994 court decision, am I to understand that it's a $300,000 balance? Will that then finish out that award? Is that a one-time payment left on the award?
I believe that's a one-time payment, but I'll defer to Lisa Annis, who may be able to answer that.
Thank you.
Thank you. Thanks, Representative.
Good morning. Thank you for the question. I believe that to be accurate, but I can go back to the team and confirm that to be accurate for you.
And so then this will be the last time we would see this then?
Yes, correct. It was a Supreme Court decision, and I believe in totality, we needed to pay the $300,000.
Okay, thank you very much. Thank you, Mr. Chairman.
Thank you, ma'am. I appreciate that. Representative Baker, sir, there are no other representatives or members of the committee here with questions for the first time. I will go to you.
Yeah, thank you, Mr. Chair. So when we're looking, there's a deficiency in the workers' compensation of $500,000. Is that correct?
That is correct. 562,000.
Oh, okay. So there were some additional workers' compensation claims that are coming in, or are you estimating that those with the claims amount to somewhere around that, and you just want to make up any shortfall that you're not sure of?
So Representative, that particular deficiency item is related to our new contract. It's with our third-party administrator. We needed to go back out to bid for that contract as it had termed out. And so within the new negotiated contract terms, there was an increase to that contract. So this $562,000 thereabout will meets the new rate for those that contractual obligation with the third party administrator.
Oh, okay.
So it's not the claims. It's really the contractor that handles the workers' compensation process for DAS and the state.
Okay. So can you give me send a breakdown of what the contract amount was the last time versus what it is at this particular time?
Certainly.
What the amount was.
Certainly, we'd be happy to bring that back to you.
Thank you. I appreciate it. Thank you, Mr. Chair. That's all my questions for today.
Thank you, Representative, for your questions. Thank you, Commissioner. Seeing that there are no other questions, I think you're good to go. I just want to be mindful and send this reminder to the committee. We have 15 other agencies that we have to get through today. So I love the robust conversations, but I just want us to be mindful of the agency heads' times. Thank you very much.
Thank you so much. Appreciate the time of the committee.
Next up, we have DESP. Hello, Commissioner. How are you?
Good morning, Representative Parrish.
It's good to see you, sir.
Good to see you as well, sir.
For the record, would you just state your name and you can go straight into the business of the committee?
My name is Ronell A. Higgins. I am the Commissioner of the Department of Emergency Services and Public Protection. I am joined here this morning by our agency CFO, Ms. Melanie Sparks. Again, I just want to recognize Senator Austin, Representative Nolan, Representative Nuccio, and other distinguished members of this Appropriations Committee. And thank you for the opportunity to speak with you regarding DESP's anticipated deficit for fiscal year ending June 30th, 2025. The department is anticipating a shortfall that cannot be mitigated with potential lapses from another account. The first account is our personal services account. I've spoken in previous testimony to the recruitment struggles faced by the Connecticut State Police, which comprise 65% of our agency's staffing. While we are beginning to realize some success in recent recruitments, having just graduated a class of 21 new troopers, it has been necessary to utilize overtime to support minimum staffing standards and to ensure public safety within the state of Connecticut. On November 1st, 2024, I began to use the full power and authority of my office as commissioner to evaluate the agency's overtime use, and I'm proud to say that we are anticipating an 8% reduction of overtime use by the end of this fiscal year. This aligns with one of my strategic pillars, one being fiscal responsibility. We are examining technology solutions that will allow everyone within our agency to be used at their highest, best use. While our efforts will continue to assist us in the reduction of our overtime costs, due to the significant staffing shortages, the agency will continue to experience a need for overtime to meet public safety needs and public demand that exceeds our current PS budget. The second area of our budget that I want to address is the Connecticut State Firefighters Association. These dollars are passed through the agency to the Connecticut State Firefighters Association, which supports benefits payments as a result.
Excuse me, Commissioner. Representative Reyes, would you mind muting your phone, please? Thank you, sir. Continue, Commissioner. Thank you.
Thank you. These dollars are passed through the agency to the Connecticut State Firefighters Association, which supports benefit payments as a result of a myriad of issues, including disability, in the line of duty death, for surviving dependent and for surviving dependent children. For several years, this fund has not kept pace with demand. We are managing claims for 14 individuals, which will result in a deficit of $65,000. I'll be brief. In closing, I just want to thank this committee for their consideration and of our requests, and we continue to balance our fiscal responsibility with operational efficiency, efficacy, and excellence.
Thank you, Commissioner. I appreciate your thoughtful testimony today before us, and certainly the work that you and your team are doing every day to protect the state and its residents. And just wanted to make sure that that was on the record. Representative Nuccio, we'll start with you, ma'am, followed by Representative Cabral-Degraw and Representative Nolan.
Thank you, sir. Good morning, Commissioner.
Good morning.
Good morning. So in regard to the deficiency that you have right now, I understand that it is primarily driven by overtime. And I also understand there are a few areas in the state budget that I think, we're going to continue to see overtime. One of them is definitely in regard to the state police. We're mandated, we have to have people on, you have to have a certain amount of people on for coverage, et cetera. I know your team was looking at, as you said, a mitigation plan. I know there was some talk of looking at, putting people back on the roads, stuff like that. I still have, with the, with what's in the future budget in relation to your mitigation plan, especially when we know we're seeing an overage right now and overtime that's going to continue. And you said that you have been putting things in place to reduce the overtime, right? As I'm sure it is a top priority of yours, we don't want to reduce overtime and create any sort of public safety issue. So in relation to that, I'm wondering if you could maybe give us a little bit more detail on how that mitigation plan is working, what you're planning to do to reduce this overtime in a way that is not going to impact the amount of shifts, the amount of people on shifts, because, I'm intimately involved with my troop, and I know we literally have like the minimum amount of troopers on at any given point. And that's concerning with call volume. So I just want to understand the mitigation plan, and in that plan, I want to also address, there are things that troopers have to do in regard to training, et cetera, stuff like that, that really cannot be done in their cruiser when they're sitting on the side of the road, especially with training plans, training programs that, you have to kind of fill all the way through. You get a call in the middle, you got to stop that training, then you have to come back. You got to start the training all over again because it doesn't hold your spot. So again, in relation to overtime, there are few departments that I think we're always going to see it, DOC, hospital related stuff. I want to make sure that we're not cutting off our nose to spite our face and just really understand it, because I am struggling with what we have right now and what we're seeing in the upcoming budget in relation to cuts in PS regarding overtime.
Representative Nuccio, thank you for that question. I can assure you and this committee that I too share the same concerns, and I am absolutely not looking at draconian measures. However, it is important that we be committed to continuous improvement and assess our agency with other agencies throughout the state and throughout the nation for best promising practices. With that, I will share with you more specifically, when I talk about getting troopers outside of the office and out into the field, we're looking at positions wherein a civilian could occupy that space. We want to use our highly trained, highly capable, highly qualified Connecticut State troopers in their best, most highest use, which is preventing and reducing crime, enforcing the law, and responding to emergency services calls. Okay, so that's how we want to use them. That will not change, but we are undergoing a staffing study so that we can assess how many we need, where we need them, but at the same time, we're looking at what positions can be occupied by civilians versus sworn. We're also looking to reduce manual processes by looking at technology that has been used and we know has been used by municipal police departments and other law enforcement agencies around this country. I feel that we can be doing better with that in the state, and where we can do better, we will do better. You heard me speak to the reduction, the 8% reduction that we're anticipating by the end of this fiscal year. As of November 1st, my CFO, my chief of staff who is here, as well as each division head meet monthly to review overtime. And what that has, what that looks like, for instance, for the Connecticut State Police, is the colonel assessing each and every one of his units, going line by line and asking the questions. Again, by simply doing that and, challenging in certain areas, we've been able to reduce overtime by not eliminating services, and it's worked well. It's worked very well. Mel, do we have anything else we want to add to that? No. Does that answer your question, Representative?
I think it does for the most part.
Okay.
And I appreciate your thoughtfulness in looking at how you are implementing this, because I do think, as I said, we have first of all, the state of Connecticut, as you mentioned, if you look at every program across the country, we're the highest trained. We have the only state that has more continuing hours than us is Rhode Island, and it's by like 2 hours, right? So state of Connecticut troopers are by far the highest trained in the country. And I absolutely agree with you that when we have people that are in the offices that can be out in the field, we want to get them back out in the field to help mitigate that overtime use. I just, it's a big cut coming between this overage and next year. And I just want to be sure that everything that is being done isn't going to penalize troopers who are trying to do training or have other things like that. I think we have to be cognizant of what we're asking of our troopers. And we also have to just be cognizant of the fact that, we still are not up to the numbers that we should be. I'm glad you're doing that, that survey or that review. I think it's going to show once again that the state of Connecticut just simply does not have enough troopers for the call volume that we have. And I just want to, again, be cognizant that we're doing this not to meet the budget, but to ensure that we've got the most optimal force. So I appreciate your answers. Thank you.
Thank you, Representative.
Thank you, Representative. We appreciate your questions. Representative Capros DeGraw, followed by Representative Ackard, followed by Representative Nolan.
Thank you so much, Mr. Chair. Appreciate you. Thank you so much, Commissioner and staff, for being here today. Most importantly, thank you for keeping Connecticut safe under what we are obviously hearing as very difficult conditions. We certainly appreciate that. Quick sort of financial forecasting question. Do you believe that you have the tools that you need to adequately forecast to basically capture that operational volatility that you experience because of the nature of the work, natural disasters, something where we'd have a public safety kind of surge, those sorts of things? Do you feel that you have your necessary tools available to you?
Representative, the state of Connecticut is prepared. DESP is prepared. And I found that when I arrived here 18 months ago. That has been also illustrated in the way that this agency has responded, and the Connecticut State Police has responded to several weather-related disasters and other emergencies in the state of Connecticut thus far.
And you feel you have the tools to forecast like future needs in terms of dollars for those sorts of emergencies?
Yes.
Okay, great. Thank you so much, Mr. Chair. That's all.
Thank you, ma'am. I appreciate that. Representative Ackard.
Thank you, Mr. Chair, Commissioner. Thank you so far for your testimony. Question on overtime. First of all, congratulations on 21 new troopers. I know you have a new class coming up. What are the average hours per week that you are experiencing in overtime?
Thank you for that question, Representative Ackard. It amounts to about 5,000 hours per week for the Connecticut State Police.
5,000 hours.
Mainly in backfills.
Backfill. So in other words, openings, the shifts you have to fill.
Yes.
And do you have a workforce need study that's done so you can't eliminate that. I get that there's going to be life things that happen in people's families that they're going to need to take time off or work or hurt on the job. What would be the trooper need to work to eliminate that or on a regular scheduling basis is what you're kind of doing?
Yeah, thank you for that question. And as a newer commissioner, that is the question that I am seeking to answer in our staffing study. in our assessment. It is time that we do so.
Thank you. And I look forward to that study whenever you get a chance to work on that. I appreciate that. And again, thank you for your testimony today. And thank you, Mr. Chairman.
No, thank you, Representative Ackert, because you took Representative Nolan's question, so you're saving us time. Are there any other questions on the floor from anyone on the committee, both online or in person? Representative Corpus.
Sorry, Mr. Chairman, I know you were getting all excited that we were done with the questions. Thank you for all your excellent work for our state. You all, two questions. Is there and I apologize if I missed this, is there a reason, what do you think is the main, or the like top three main drivers why it's difficult to recruit troopers into the state of Connecticut?
That's a question that I hear often, Representative. The first I would say is there's been a lesser amount of people wanting to go into the profession, entering into the profession. With that reduction of people that are entering into the profession, there is also the variety of options that those who do want to enter into the profession have. So for instance, the state of Connecticut, there are a number of police departments that are hiring every single day. So, people have their choice of where they would like to go. The third is, and this has been discussed amongst chiefs here in the state of Connecticut, candidates. Candidates, for a variety of reasons, are not able to pass the high standards that this state has set. Rightfully so. Rightfully so. We should not be reducing standards, but because of life choices, behavioral decisions, they are just simply unemployable as police officers, so they cannot get through the process. So we're finding ourselves swimming a little bit further upstream, talking to younger people about careers, not just in law enforcement and public safety. I was with the recruitment and selections team just last night at a Connecticut university who was recruiting, and we're also going out of state. This team is going as far as Virginia to recruit, as are other police departments and state police departments in this country. So I believe firmly that we will get back there, but we're not going to get back there sitting and posting and praying for people to apply. We have to get out there and we have to do the work. And I'm proud to say that they are, in fact, doing the work.
Thank you. And another question, is any part of your, was any part of your 2025 budget federal funds that you can no longer avail yourself of? And is any part of your 26 budget now a zero as a result of federal funding? And if so, we're prepared to step in and help.
Good afternoon, Melanie Sparks, DUSP CFO. Thank you for that question. At the moment, we are, like our sister state agencies, monitoring the federal environment, but no, the answer to your question as of this moment is no.
Thank you, Representative. Representative Delnicki.
Thank you, Mr. Chair. And I was just listening to your testimony about the high standards, and I was processing it and thinking about it. Is there a possibility to have in the military for the officer candidates, they have like a prep school where they can actually prep candidates to go forward?
Representative, I have to cut in there. That's not necessarily relevant to the bill before,
No,
sir.
no, but if there were a conceivable cost to do that, would that be a germane question?
Question's not germane, sir, unfortunately, and I wanted to
Okay.
be respectful, certainly, to Representative Corpus, because I think we got off on the wrong spot here, and I say that because Representative Reyes had a question that was not germane to the bill, so I do want to keep us on track there, if you don't mind. I'm happy. I think the commissioner would be happy to answer that for you outdoors, but I just want to keep us moving along. I hope you understand, sir. Thank you, Representative. Seeing that there are no other questions, Commissioner, thank you. I do know that a few of the legislators do have questions for you that hopefully you'll be able to take outside the room.
Thank you for your time today.
Next, we have the military department up. General, good to see you, sir. If you would mind stating your name and who's with you from your department, that would be most helpful. And then as others have done, you can start with your testimony. We'll follow up with questions from the committee afterwards. Thank you.
Absolutely. Thank you, Representative. And as distinguished members of the Appropriations Committee, I'm joined, obviously, I'm Major General Fran Yvonne, the Commissioner and Adjutant General of the Connecticut Military Department, and I'm joined by Maria Morales, who is our acting physical administrator. And I thank you for the opportunity to testify before you in support of House Bill 6863. The governor's deficiency bill represents deficiencies as projected as of January 2025, and the department concurs with the Office of Policy and Management's latest projections for PS, personal services, and OE from their March 20th forecast as well. The Connecticut Military Department supports 35 different facilities that serve to support the men and women of Connecticut's home team while they train and prepare for our nation's greatest challenges, both at home and abroad. Over 1,500 members, soldiers and airmen of the Connecticut National Guard, will deploy overseas in the next 2 fiscal years. This deficit in OE that we see today is partially due to a result of an unforeseen rise in utility costs of approximately $85,000, which represents a 10% increase. Additionally, contract renewals contribute to increased and unforeseen costs. Pre-COVID contracts that have recently come up on renewal are up to 3 times the cost, and that 3 times the cost of the previous contract. It's basically a 40% increase in custodial service. So that's where the major hit in our OE has come. The agency's projected deficit in PS is primarily due to unforeseen rise in the use of our state active duty orders on missions and operations for which the agency is not reimbursed or is awaiting reimbursement. So operations like the Hawthorne Fire or our support to North Carolina during Hurricane Helene are bills that yet to be paid, so deficiencies that'll be reimbursed. Other unforeseen operations include the Governor Ralph funeral and the expenses that were associated to that, stable duty for our horse guard, and special projects that are not reimbursable. In addition to the stable duty, operational costs involving the Governor's Guard are borne entirely by the Connecticut Military Department. So the department continues to be ready to provide ready units, organized, manned, trained, and equipped to facilitate and face the many challenges of the modern world. So I thank the committee for your continued support to Connecticut's home team, small but mighty, always punching above our weight class, always ready, always there. And I appreciate the opportunity to address you today, and we'd be happy to answer any questions.
Thank you, General. We appreciate certainly your service, not only to our residents, but to our great state. We have one quick question from Representative Nuccio.
Thank you, Mr. Chair, and thank you, General. So quick question for you. You had mentioned that some of these are reimbursable. Is there an expectation that we won't receive the reimbursement by the end of the fiscal year, and that's why it's showing as a lapse? Or is it typical for us to have a deficiency? Is it typical for us to project a deficiency for something that we may get reimbursement on, or has that been calculated in?
So
You know, that's
it's
kind of like
typical that we show that. We're hoping it's not going to lapse, but
Okay.
projected and forecasted for right now, it does show. But we one of the reimbursables is organic to another agency, and then the other is out of state to North Carolina. So we continue to process that through as we
And
go forward.
Do you happen to know the total of what you expect to get back for reimbursement?
So those two, the Hawthorne Fire and Hurricane Helene, represent $85,000.
Okay, so we'll still have a deficiency. It's just going to be smaller.
Yes, ma'am.
Thank you very much.
Thank you, Representative. Any other questions? Representative Nolan, and followed by Representative Cordes.
How you doing, sir? Thank you for being before us, and thank you for your service. And just a real quick question in regards to the higher rates of active duty for National Guards. Can you kind of break that down when you say higher rates? Can you explain which?
So it's
rates?
actually a good news story. So that's a great question. So thank you, Representative. So state active duty, under the confines of the statutes, we're able to bring people in, soldiers or airmen, members of the organization, and they can do temporary duty. So we pay them state active duty to do special projects. It could be an engineer for a given design. So instead of having to hire a permanent employee, we use the state active duty to plug some gaps, short-term gaps with temporary hires, basically. So they may come in for a week on a special project, or the other way we use state active duty is for training. So they may come in for training. You're very familiar with the SWAT challenge. So the train up maybe a couple of days prior to the SWAT challenge competition, we may bring them in for that. So that's also additional expense, but not necessarily line itemed or reimbursable, if that makes any sense. Thank you.
Thank you, Mr. Chair.
Thank you, Representative. Representative Corpus.
Thank you, Mr. Chairman. Thank you so much for being here and for your service. Is there anything in your department's budget and for the fiscal year 25 or 26 that has been cut off by the federal government? Any shortfalls in your budget for this year are anticipated because of that?
That's a great question. $1 million question, I'd add, right? As you'd asked, but quite honestly, over the last 2 years, so even previous to the current administration, we've seen a decline in federal money overall. We had it, and this year we're currently on because of the continuing resolution, we're on our FY24 dollar amounts. We temporarily had to close our star-based program, so it's an Air Force funded program for 8th grade to 12th grade students that come in for like summer camps. And it's a STEM related program where we put some folks through. It's actually 5th through 8th graders. We're trying to grow a program that covers 8 to 12. And then after high school, we're ready to enlist them into the Army Guard or Air Guard. But it's 5th through 8th graders. So temporary slowdown on that, but that's not related to the current administration. We are fighting tooth and nail to ensure that our units are manned, fully manned, and we're recruiting to, so similar to the state police. We have some higher standards maybe. We're always looking for talent and new recruits. And thanks to this committee and to the legislature, we have our JEEP program, which is our Joint Enlistment Enhancement Program. It's a good news story. It's contributing to the deficit, but our members who recruit others to join the organization are reimbursed with a stipend. And we are burning pretty hot in that pool of money. Again, it's a good news story, but what I'm really getting at to answer your question is that if we lose, if our strength numbers are not where they need to be at per standards, then we potentially lose units and equipment that goes along with that, and then the federal dollar. So we're fighting tooth and nail to maintain our strength, which we call readiness. So recruiting and retention is the readiness of our organization. And then based on the number of units and people we have, that signifies the type of equipment we have. It signifies the type of full-time personnel we have. So we do anticipate some cuts. Overall, the federal government, what we're hearing is they need to, it's everything that you read about, but they need to figure out a way to fund what we need to get after in the future. So for the last 30 years or 25 years in Iraq and Afghanistan, in many cases, we've been outpaced by China. So the sole focus is how we get after that. And really what it comes down to is how is the government going to fund that? So we want to make sure our units are at full strength or pretty close, as close as we can get, so that we're not in jeopardy of losing. We actually believe we're postured to grow. So we're looking for opportunity in all the turmoil that's presently going on to see if we can grow units and structure that will get after both the federal mission and our state mission when called upon.
Thank you. So other than that ordinary course, that is that the constant dynamic with the federal government and your enlistment numbers that you want to keep up in order to get federal funding, I'm trying to reconcile what I read with how we can step in as a state government if there has been, in fact, a pullback in your area. But as you see it, other than that regular way dynamic, there's not been suddenly a $5 million number that went to zero, for example, for fiscal year 2026 or for this one that we're in 25.
Not yet. No, ma'am.
Okay,
No.
thank you.
Thank you.
Thank you. Thank you, Representative. Thank you, General. Representative Fonsello.
Thank you, Mr. Chair. General, thank you for coming today and thank you for your service. In normal times, we'll say, forgetting about the current fiscal situation, for repairs, maintenance, for vehicles, aircraft, is there any sharing of the funding for those with the federal government?
Yeah, it is. So absolutely.
Thank you, sir, for your question. Yes, there is a state share. Sometimes it's 50%, sometimes it's more depending on the facility and the use of square footage. So yes, there's some 100% federal, but almost always a state share.
Okay, and now looking at current times, is there any reason to believe that you would not receive the federal share towards maintenance and?
So we
Sorry.
do expect a shortfall or less money. Like I said, the trend over the last 2 years that we get less federal money. Over if we go back 15 years, I think we've relied more on the federal money and maybe at the expense of some state money or programs or even personnel. But again, I think a lot of it's based on the density of units, personnel, and equipment, and we're going to fight tooth and nail to maintain what we have, and we're postured very strongly in that effort, based on, again, thanks to the legislature for this enhancement program that we have. It's really helping our newest members recruit their friends and neighbors and siblings. So we're hoping that shortfall is overcome by that.
So in extension of the question, then, do you see any changes in your AGR strength?
So we're fighting for, that's this pet peeve, maybe a sore subject right about now. Quite honestly, we think there's no, so we've got many different statuses. We have about 600 technicians, so GS level technicians that are getting all of those emails about tell me what you did last week, 5 things, and answer the email, don't answer the email. Cuts in AGRs we do not expect. There's some efforts underway with National Guard Bureau that they may rebalance the production recruiters, and we are fighting that tooth and nail based on our size and allocation. But again, unit based, if a unit went away, that would take that asset, the full-time support that goes along with it. On any given day, full-time manning, we fought at least for the last 8 years, if not longer. We're at 49% of what we should be. So there's not much fat to trim per se. And really at the national level, so the 50, we call it the 54, the states, the territories, and the district, we are ready and posturing to work with the administration, to take on the administration, to ensure we think we're the best value cost proposition to the nation, right? We represent the National Guard across the 54 represents 20% of the joint force for 4% of the DoD budget. The DoD budget is $850 billion. We think we're a good value proposition and why we shouldn't be cast back into the strategic reserve prior to 9/11. So my counterparts and I and the staff, we worked that day in and day out for sure. Thank you.
Thank you, sir. Let us know how we can help
Thank you.
going forward.
We appreciate the
Thank you.
support. Thank you.
Thank you, Representative. General, doesn't seem to be any other questions. Once again, we thank you for your service and your advocacy for our great state. And we look forward to working with you in the future. Thank you, sir.
Thank you.
Next up, we have the Department of Labor. Commissioner, good morning or afternoon.
Good morning.
How are you?
I'm well, thanks. How are you?
Good, thank you. Please go in and begin.
Yes, thank you. And thank you, Rep. Harris and Rep. Nuccio and honorable members of the committee. I'm Dante Bartolomeo, Commissioner for Department of Labor. I'm here with our CFO, Christopher Levine. And we currently have a deficiency of $500,000. And that is made up of a variety of costs related mostly to personal services funding that has been provided to us without the other expenses associated with that, as well as some inflationary costs, electricity, telecom, and so forth. And I am happy to answer any questions.
Thank you, Commissioner. We'll start with Representative Ackard.
Thank you, Mr. Chairman. Mine's, I understand your, the deficit, but we had chatted earlier about, inspections that the department does, and to make sure that the workforce is, doing the right things out there. And I take it there are fines associated with those, inspections that a contractor then has to pay. Do those fines stay within the department?
Yes, so you're talking about the civil penalties associated with the Wage and Workplace Standards Division. And we do have the ability to retain those funds, and we do actually have staff on and associated with those funds, multiple staff.
Thank you. And what is the scope of dollars that you receive for those penalties? Would you have on a yearly basis, or how do you?
Yeah, we're running about $1 million per year, and we have had in the last few years anywhere from 6 to 10 staff that are funded. Their salaries are funded, and their overhead associated with that are funded through the civil penalty fund. We keep track of it very closely. It needs to be rather dynamic. There's been times where we have a slowdown, for instance, associated with the pandemic, where we weren't able to do that kind of work out in the field. And so we keep very close track of it. We work with OPM when we are concerned about the fund's ability to support staff. And so we have had a little bit of back and forth in the past few years, but it's a necessary component of our revenue at this point in time in order to provide for even the staff that we do have.
Thank you. Thank you. I think the value to that is making sure that the job sites are safe and that the people on workman's comp, and I appreciate the work that you do in that area. Thank you. Thank you, Mr. Chairman.
Thank you, Representative.
My apologies. Thank you both. Representative Cabral-Segral, my mic was off.
Thank you so much, Mr. Chair, and thank you so much, Commissioner, for being here today. I certainly appreciate all the constituent help that when I have reached out that your agency has provided. I just wanted to get a better sense of, has the financial deficiency affected your department's ability to deliver workforce development and unemployment services, or do you think you've sort of been okay?
The $500,000 deficiency has not impacted our ability to do the work of the agency. We just do not have the ability to cover that in any way, shape, or form without coming here.
Okay, I appreciate that. Thank you so much, Mr. Chair, and thank you, Commissioner.
Thank you, ma'am. Representative Nolan.
Thank you, Mr. Chair. Good afternoon. Question is, are there specific legislative actions or support that DOL believes would assist in resolving the current deficiencies and strengthening the department's financial stability?
Well, as far as supports, I think I would look to how we got here from some of these, and some of these are legislative actions which accounted for how we got here. So for instance, there's bills that have been passed. The Office of the Unemployed Workers Advocate, for instance, is one. The apprenticeship reporting bill is one where we've had staff provided, but just the PS and not the OE. So in that regard, when you are passing bills that provide us staff, we thank you, but please provide the OE as well.
Yeah. Okay. Thank you very much. Thank you, Mr. Chair.
Thank you, thank you, sir. I appreciate that. Representative Corpus.
Mr. Chairman, thank you for being here. At the risk of sounding like a broken record, but that ship has probably sailed. Has there been any impact on your work and the important work you do for the state as a result of federal cuts either in 25 or 26?
Thank you. While we had a couple scares at this moment in time, based on a couple temporary restraining orders, there is no impact to our agency from the federal.
Thank you. That should change. That's what we're here for. Thank you.
Thank you.
Commissioner, it doesn't look like there are any other questions, so I'd like to end with this one. I know that there are a lot of challenges that are facing not only our state, but certainly your agency. And I would just like to know how confident you are as the head of that agency in your forecasting model for unemployment claims and benefits, and what outside economic or actuarial advice, if you will, are incorporated into those projections over the next year and a half.
Well, we have economists on staff. We do our very best in the modeling. I'm very confident that we actually have a phenomenal team. The problem is that there's no current stability or reliability of what we have coming towards us. So we are about 70% federally funded. The UI program, if you were to reference a USDOL's website, is said to be a federal and state partnership. And so we do not receive the funding, all the funding needed to operate that program with the level of customer service that we would like to. We have situations in the past, and we do have concerns that they will continue, where our payment is I'm going to say retroactive model, but it's not exactly that. It's just the best way I can describe it. So we submit for work done, and then the federal government determines how much they had put aside. They split it between states and try to make it based upon our the level of work that we've done, how much work we've done, and then we get a base grant quarterly, and we sometimes get an above base grant as well. We've seen above base grants cut to zero recently, and we've seen decreases in the base grant, and it often means that it doesn't align with and support the work that we've already done.
Right. That's helpful for us to know. I appreciate that, Commissioner. Thank you. Seeing that there are no other questions, we appreciate your comments and testimony for us today. And we look forward to seeing you soon. Thank you, Commissioner.
Thank you.
Next up, we have the Commission on Human Rights and Opportunities. Director Hughes, how are you? Good, thank you. Madam Director, you are free to begin whenever you choose to.
All right. Good afternoon, Senator Osteen, Representative Walker, Senator Summers, Representative Nuccio, and members of the Appropriation Committee. Thank you for the opportunity to testify today regarding the proposed $500,000 reduction in appropriations for the Commission on Human Rights and Opportunities. I'll just summarize our testimony. I know you have it before you, but the proposed $500,000 reduction in other expenses would be drawn from the remaining funds in the $4 million appropriation for the equity and disparity studies. As you know, the equity study, which directed the CHRO to oversee an evaluation of equity in state government, was included in the Public Act 21-2 of the June special session. And the final equity report was issued in January of 2024. The final cost of that study was $914,890. Special Act 21-8 required CHRO in consultation with DAS to contract with a private firm, which we did, and that firm was Griffin and Strong. And they began their work in April of 22. The final study report analyzing state spending in fiscal year 2017 through fiscal year 21 was issued in December of 2024, and the final amount paid to the firm was $899,000 and $899,830. So we believe that through prudent fiscal management of those two studies, we were able to keep the combined cost under the $4 million originally appropriated for the studies. And the unallotted balance left in operating expenses for the study was over $1.6 million. Following a $900,000 holdback, that would leave a balance of $714,000. And so the $500,000 now would bring us to about $200,000 to implement the study. So as laid out in our testimony, to properly implement the study, recommendations that pertain to the CHRO would need a new project and plan tracking system for our contract compliance unit. And depending on whether or not we purchase an internal tracking system to be used by our staff or an external facing program that will be used by CHRO staff, and would allow contractors to submit plans electronically. The purchase price and annual operating costs of a system would range from 100,000 to, for the purchase price and 50,000 a year to 400,000 for the purchase price and approximately $150,000 a year. In addition, the contract compliance unit would need an additional attorney and an investigator to assist with regulatory drafting, conduct site visits as recommended by the study, as well as to investigate and potentially litigate an estimated 30 cases per year. So the decision to appropriate the funds needed to conduct the first Connecticut disparity study since 1991. This body demonstrated its commitment to strengthening our state's small and minority-owned business contract compliance program. And now it's time to complete the study with implementation. We believe that by not implementing the study results would not only waste the money that has already been spent on conducting the study, but would also leave the current contract compliance program unsupported by accurate data. And so we urge this committee to remove the $500,000 reduction in the remaining study fund and allow the CHRO to implement the changes recommended by that study and address the fundamental inequalities that continue in state contracting.
Thank you, thank you, Director. I appreciate your thoughts and testimony and thoroughness in what you've delivered to us. It's quite helpful to us. Are there any questions from members of the committee? Of course, Representative Nolan.
Thank you, Mr. Chair, and thank you for coming before us. And I'm in agreement with you in regards to the importance of making sure that we complete the job that we tasked you to do. This body here put that before you, and you wouldn't be able to do it without the funding mechanism that is needed. Can you just elaborate on the specifics that the funding will cover that you're requesting?
Certainly. No.
Good afternoon. I had to check the time to decide whether I was going to say good morning or good afternoon. My name is Cheryl Sharp. I'm the Deputy Executive Director at the CHRO and a Commission Attorney. And so specifically for the implementation of the disparity study recommendations, there are several things that need to be done. One is that there needs to be an education and outreach campaign done to contractors, subcontractors, minority business enterprises, educating them. We need to collaborate with DAS to provide that education to them regarding the hundreds of millions of dollars of public works contracts that are done by our state every year. And so that there comes a cost with respect to that, depending on what venues we're going to use, whether or not we're going to offer light fare to individuals when they come for the training, the printing of the materials, the production of the materials, and so forth. Additionally, there are the informational sessions that go along with that training, the certification process. There would be some overtime hours involved in terms of staff or comp time, because our attorneys get comp time as opposed to overtime, but our investigators get overtime. So there are costs associated with providing that education, that information, the uploading of the information to the website, the creation of videos, which we've done with our sexual harassment training, if you're familiar with that. We produce the sexual harassment videos, and then they've been utilized by hundreds of thousands of employees across the state of Connecticut. We would endeavor to do something very similar here. Also, in terms of implementation and specifics, we do need a data system. What we use now is pretty archaic, but we're making the best of what we have. But certainly, we would like to make it easier for contractors, easier for state agencies to be able to access the various databases and portals and so forth. All of those things come with a price tag, and traditionally, the agency, the Commission on Human Rights and Opportunities, has a very broad remedial authority, very broad statutory and regulatory authority and responsibility, and we've been understaffed and under-resourced for years. Currently, with the hiring freeze, we have had people who have left, and we haven't been able to hire anyone prior even to the soft freeze that is currently in effect. So we just want to make sure that we can use the resources that we have been appropriated for this purpose to meet the needs of the stakeholders, especially during this time and period of rollback of civil rights. It is critical now more than ever that the state of Connecticut double down and show the world, because they're looking at us as the oldest governmental civil rights agency in the nation, to be an example as to how things should be done, how fairness, equity, and equality should be done, and state to state. And so those are some of the costs associated with the appropriation and allocation of those funds for the purpose of implementing the disparity study recommendations done by a firm that was chosen by not just the CHRO, but by DAS, and it was sanctioned by DAS, OPM, and CHRO because they're a national firm. So we take their recommendations seriously.
Thank you for that information. And it's something that I thought was necessary, that people understand what is needed for that. Thank you, Mr. Chair.
Thank you, Representative Corpus.
Thank you, Mr. Chairman. Thank you for being here. I was very persuaded by your testimony that we've invested in this important project and we need to complete it. What is the total cost of the study? I just no sense of that.
So the appropriation was for $4 million that we've been allocated a portion of those funds. The firms themselves, the total amount was
1.6 million is what the total cost of both studies has been spent.
for the firms to do the work that they did. But in addition to that, we've had some rollout, and we're in the process of a Civil Rights Unites tour currently. Actually, this evening, Tanya and I will be in Bridgeport for one of the rollouts of the disparity study. There, we've had a legislative breakfast. There's cost associated with the rollout and the education and the production of materials and booklets and information, so that small minority-owned businesses, whether they're ethnic minority-owned businesses, women-owned businesses, disabled-owned businesses, which a lot of times are veteran-owned businesses, that there's materials associated with it. There are the informational sessions. There's the cost of the arenas that we have to use. We've tried to contain the cost because we met with OPM to work out a cost containment plan that we think will be effective, and so we have cut the cost substantially in an effort to meet the needs of our state and balancing the budget and the overrun of funds and the need for overtime and so forth. So we are definitely working with our OPM analysts to try and ensure that we are good stewards of the dollars that we're responsible for handling.
Thank you. And is the important work that you all do solely state money? Are you affected because of the subject matter in which you deal? Are you affected directly by anything happening at the federal level?
We are substantially equivalent to our federal sister agencies, the EEOC, which has received deep cuts, and HUD, which also has received deep cuts. And so we do get some funding from them. We get maintenance of effort funding that goes to the general fund every year of approximately $1.2 million. That's the maintenance of effort funds that goes directly to the state. In addition to that, we get HUD administrative costs funds of a much smaller amount, around between 50 and 100,000. And then we get travel and training funds based on our FTEs, our full-time employees working on housing matters. We also yearly, for as long as I can remember, have received FAP partnership grants. But this year we didn't, although we submitted a FAP partnership grant application and a C-Fund application, and we never heard back regarding them other than everything was on hold and that, at some point someone would get back to us. But then we were informed that other FIPS were FAP, but that FIPS, Fair Housing Initiative programs, had their funding cut in Connecticut. So presumably, we won't receive that FAP partnership grant. Those partnership grants allow us to actually do business with nonprofit organizations and other private companies in the state to help advise individuals, stakeholders about their fair housing rights, and also to reduce homelessness and reduce discrimination in housing. So we didn't get that grant this year, and we don't know what will happen with that funding going forward. And so where there's a will, there's a way, though. We have all been I've been with the CHRO for 30+ years. We've always been understaffed, always been under-resourced, but we're just, I guess, worker bees.
But if I could add, we did complete all of our federal contracts for last year, and we did deposit all those funds into the general fund as of December 2024. We've been in touch with our federal partners. We're advised to continue the processing of the cases. We've seen an influx of cases because of the reduction in force on the federal level. I believe they've already experienced about 60% reduction in force, but they're relying on us to honor our workforce agreement contracts with them and continue our partnership. And so we're continuing the work vigorously.
So it sounds like it's about 1.5 million in 2026. And then what was the FAP amount?
It's about
It's like $400,000.
Okay, and that would hit in both 25 and 26 potentially.
Correct.
Okay, thank you.
Mhm.
Thanks for all you do.
Thank you. I appreciate that. Any other questions, concerns? Seeing none, thank you all so much, and thank you for the incredible work that you're doing. We appreciate that.
Thank you.
Thank you. Department of Housing. Come on down.
Good morning, Representative Corey and distinguished members of this committee. My name is Seila Mosquera Bruno. I'm the Commissioner for Connecticut Department of Housing, and with me is Steve Dalila, Director of the Individual and Families Support Services that we have. Thank you for the opportunity to have me here to testify in support of HB 6863. The Department of Housing is projecting a $7 million deficit due to rent increases in our rental assistance program. I submitted written testimony, and I'm happy to answer any questions.
Thank you, Commissioner. Representative Nolan. I just could feel you looking.
Thank you for the opportunity, Mr. Chair, and thank you, Commissioner, for coming before us. And as you mentioned, the RAP program, that is very dear to many of us, and it just affects our communities a great deal. Can you just give a brief understanding of what that program does so that those who may just be wondering, in case they don't know the details, so they can understand?
The rental assistance program provides rental assistance to about 6,400 families and individuals, and is dedicated, or the families and individuals that participate in the program are at 50% or below of the area median income.
Thank you. Could you share how long that program has been around?
Mid-80s.
Mid-80s? Okay, and I'll stop there.
Yeah, thank you. I almost got you. I appreciate that. Any other questions in the room? Please, God, any question other than Nolan? Representative Corpus, followed by Representative Cavros DeGraw.
Thank you.
You're welcome.
For all of the work you do, and it's nice to see you again. I sit on housing, so we've seen each other before. Is there anything, Any federal programs affected your ability to do your important work in our state in 25, or do you anticipate for 26?
In our operations, no, really. We do have one program, we were working with DEEP and Department of Transportation for a resilient project in Bridgeport, and that money went away. So we are thinking about how we will proceed.
How much was that?
I think it was about $70 million.
Okay. And what was that going to do?
It was going to provide some safeguards to the flood in the south end of Bridgeport with a wall, retaining wall, as well as some gates to protect when there is a major flood or hurricane. We learned from Hurricane Sandy, that area was flooded and damaged a lot of the homes around there.
And does that come under your 26 budget, or it's not?
No,
here,
that was a
obviously?
separate project.
Okay.
That's under a project.
Thank you.
Thank you.
Thank you, Representative Cabral Cabral.
Thank you so much, Mr. Chair. Again, apologies, my camera's not working today. Commissioner, it's great to see you. Thanks for all the good work. Just wanted to get a sense of the impact that the funding shortfall has had on the existing rental assistance or homelessness prevention programs in terms of, have services had to be scaled back or delayed?
Thank you, Representative, for that question. So when we deal with a situation like we have with the rental assistance program, what we need to do in order to try to maintain within our budget is to not refill turnover units. So if somebody leaves the program, we'll not be able to put a new person in. So that does slow down placements from a wait list. And if there is a vacancy in any of our other programs, that would also slow that down as well.
Okay, and with Mr. Chair's indulgence, the follow-up to that would be, are there, specific populations like veterans or families, the reentry community, that are disproportionately affected by that shortfall that, slows things down?
That's a really, really good question, because it really depends on the individual that has moved on from the program. So it depends on where that comes from. So we have a wide variety of different subpopulations within the rental assistance program. For instance, we have family reunification with DCF. We also have programs that do assist the homeless and veterans. So it really just depends on if there's a higher turnover rate across any of those separate subpopulations. They tend to be relatively consistent. I would say some of the people with maybe are some of the higher needs populations may have a little bit of a higher turnover rate than others. But for the most part, we've been able to maintain at least the service component of it while we try to deal with the shortfall.
Okay, thanks. I appreciate that. If there's any way that we can receive documents after the fact that might detail that further, that would be great. And if not, I understand. Thank you so much, Mr. Chair.
Thank you so very much. Representative Dathan.
Thank you so much, Mr. Chair. Nice seeing you up there. Thank you, Commissioner, for your testimony today. This has been really helpful. I know a few folks were asking about the federal cuts. I'm just wondering, with the number of employees that the agency has, some of which are provided by the state government, some are provided by the federal government. How many employees, if any, have been laid off so far as a result of the DOGE cuts?
None. So far, finger crossed, we are level for this year. I have 71 employees and my budget is about 60% federal. But however, the housing programs are still in play for this year.
Okay, well, that's good to hear. And Rep. Cavos-Straga asked my question about the RAP vouchers, which and the other sort of federal vouchers that we get. Are you aware of any, and apologies, Mr. Chair, if I'm stepping out of line here, but just
Yes,
wondering.
I have a side eye here from Representative Nuccio, so I just hope that it is germane to the bill before us.
Yes, and if it's not, you may cut off. I'm more concerned about folks that are in section Section 8 vouchers from the feds. Are there any risk of those going away that you're aware of? And that we might have to pick up as part of our future RAP programs?
What I have heard so far is that the families that have Section A now, they will keep those. Families, we will not have the ability to list up to any voucher that we get back in return. As Steve was talking about the rental assistance, we get some vouchers back when a family leaves the program. We are not, right now, we do not have the ability to use those vouchers again.
Okay, that's helpful. Thank you so much. And thank you, Mr. Chair.
Thank you. I appreciate that. Any other questions? Seeing no other questions, Commissioner, thank you very much for your time, man. We appreciate it.
Thank you very much.
Next up, we have the Agricultural Experiment Station.
Mr. Chairman, Mr. White is online.
Thank you. Thank you, Madam Clerk. We appreciate that.
Hello, can you hear me?
Yes, sir, we can.
Okay, good afternoon, Representative Paris, Senator Austin, other members of the Appropriation Committee. My name's Dr. Jason White. I'm the director of the Connecticut Agricultural Experiment Station. Apologies for being the first commissioner that's online. So I'm here to give testimony on our agency's estimated $300,000 deficiency. You do have my written testimony, so being cognizant of everyone's time, I'll just quickly summarize. The deficiency is a function of two factors. The first is related to agreement between the state and CBAC, which allowed P4 union employees to increase their hours from 35 to 37 and a half if they had 15 years of service. Of the 32 eligible staff members, 29 took that, and that estimated cost is about $132,000. This cost was not appropriated. And also is not appropriated for 26 or 27. The other remaining 170,000 was related to accrued payouts for retirements. In addressing this moving forward, obviously the second factor is a one-time charge, but for the P4 staff issue, we'll be delaying hiring so that we can cover those costs in the future. So I'm happy to take any questions you may have.
Thank you very much. Any questions from the committee? Well, this might be a first. Director White, you're off the hook.
Thank you. Have a good afternoon.
Thank you very much. Next, we'll have DPH. Hello, everyone. Commissioner, good to see you. Thank you. You may begin at your leisure, ma'am.
Thank you very much. My name is Manisha Jutani. I'm Commissioner of the Department of Public Health. And thank you to the committee, Representative Paris, Representative Nuccio, and all other respected members. With me here today, I have Deputy Commissioner and Acting Chief Operating Officer Adelita Orfici and Deputy Chief Operating Officer Nick Jakubowski. We're here to discuss the deficiency appropriations and shortfalls for fiscal year 2025 in the DPH budget. You have my written testimony in front of you. To summarize the 2.21 million shortfall that is anticipated. The large majority of that is related to personal services. In fiscal year 24 and 25, we worked very diligently to fill vacancies that were necessary and instrumental positions within our department, many of them at the managerial level. The other parts were from our other expenses account. And for that, there were three main reasons. One was related to the closure of Stone Academy in February of 2023. People who graduated from the program but needed to pass the NCLEX exam were offered, who passed the NCLEX exam, took a re-nurse course, and DPH bore the responsibility of the payment for that course. Secondly, there was a study that the legislature had requested $1 million in ARPA funds for a study related to COVID-19's impact on obesity. That study later on was terminated, and the remainder of the balance for that, for expenses that had not been submitted prior to the termination of that in a next legislative session's appropriation, we then paid for out of our other expenses. And then lastly are the operating expenses of our state lab, which specifically on electricity and biological waste management systems have continued to increase at a rate. So the last is our local health departments that receive per capita funding. Specifically, Durham joined the Connecticut River Area Health District, and that now made them eligible to receive per capita, and that is the summary of that additional expense item. So I will leave that summary to you and am open to any questions that you may have, given my testimony.
Thank you, Commissioner. Representative Nuccio.
Thank you. Thank you, Mr. Chair. And thank you, Commissioner. I was wondering if you could just help me understand something. I'm looking at the OFA expenditure detail for March, the end of March. And I know we're into April now, but looking at this here from the total budget amount for DPH, it was $74 million, and we're projecting out about $72.6 million, which is showing actually a lapse. So I'm just looking at the actuals and trying to see where this deficiency is coming in, because I don't see it on here. Gotta push button.
I think that you're talking about the difference between the actuals and what we're projecting.
Correct.
You're showing us as coming in under budget?
Well, I'm showing, according to the OFA expenditure detail report, Department of Public Health, you had $74 million in your original budget, and they're projecting you out at $72.6 million. So it's showing a $2.4 million lapse, not a deficiency. So, and I'm looking at your line item specifically to what you had there, and it just doesn't seem like it's lining up. So I was wondering if you could kind of help me reconcile between the two.
Yeah. We'd have to look at that. That's not the report that we prepared to discuss. We were.
Okay, then,
Yeah.
all right.
I think also that may be an overall, I think specifically related to operating expenses and PS. Are you looking at those specific line items there, or are you looking at an overall?
So I'm looking overall, but I can also
Right.
see PS, you had about 41 million in the budget and you're projecting out about 41 million. It's about $100,000 lapse. I mean, 100, like it's not a big number, $100,000 increase, right? So a small deficiency. And then for OE, I do see like the numbers growing, but they've been making adjustments throughout. So I'm looking in total at what's in DPH between what was budgeted and what is being forecasted. And it just is not reflecting a deficiency. Is it giving
Nick, do you have
the-
anything additional to add at this point? Other,
Mr. Chairman, I apologize for the interruption, but if we could have the name of the person all the way to the left, just for the record.
it's
That is perfectly fine. Please state your names for the record so that we can have that for our viewers at home, and also for the record of the committee.
as I stated in the beginning, this is Deputy Commissioner Adelita Orifici, who's also Acting Chief Operating Officer.
Thank you very much. Deputy Commissioner?
Yes, I see we just got the report from OPM, and it looks like you're looking at the projected deficiency of approximately $2.4 million.
So it's actually a surplus. It's a lapse. It's not a deficiency.
And $430,000 in lapsing accounts. The gun violence allotment reduction of $2.5 million. Announced by the executive branch was previously projected as a surplus, which offset account deficiencies in the agency in prior projections. The anticipated deficiencies are, I'm just going to read this because I haven't seen this before. 1.8 million in personal services due to an increase in staffing and overtime costs. 1 million in other expenses primarily due to increases in the lab expenses that. 3 is 18,801 in the local and district departments of health, which the commissioner talked about, related to Durham joining the Connecticut River Area Health District. And these are offset, and you'll see this in our testimony, by $232,000 in the lung cancer detection and referral account, and $198,000 in the school-based health clinics. I think what you're missing from this is the $2.5 million of surplus in the gun violence allotment.
So that was reduced, right?
Correct.
Correct.
Yes, it was reduced and then reallocated throughout.
Correct. Yeah. Yes.
Okay, so again, though, if you're just, I think maybe you guys should take this away, because you're looking at the actuals at a budget of 74 million and a projected actual of 72.6 million. You have a $2.4 million lapse. That's what I'm struggling with. I don't see a deficiency anywhere in these numbers. So the written testimony is not tying off with what we have as actuals. So if you want to take that away and look at it and get back to me, I appreciate that. But that's basically my question. The numbers aren't tying.
Okay, will do.
Thank you.
Thank you very much. Any further questions from members of the committee? Seeing none, thank you, Commissioner. Thank you all for your hard work. We
Thank
appreciate you.
Thank you very much.
Office of Health Strategy. Commissioner, how are you?
I'm well, thank you.
Good. You can begin whenever you please.
Thank you very much. Nice to see you,
as well.
Representative Paris, Representative Nuccio, members of the committee. I'm Deidre Gifford. I'm the Commissioner of the Office of Health Strategy. You have my written testimony. I'll just briefly summarize. As in prior years, this governor's bill makes a deficiency appropriation addressing our fiscal shortfall based on OPM's most recent projections. I have some good news, which is as of fiscal year 2025 has progressed, the Office of Health Strategy currently has a projected deficiency that differs from the January 2025 estimates utilized to inform this legislation. So based on the projections from the March 20th comptroller letter from OPM, OHS currently has an estimated deficiency of $240,000. This is in our PS account. It is within the agency's holdback for this year and is also a result to some extent of hiring that went more quickly than anticipated. In consultation with OPM, we anticipate this deficiency can be fully mitigated through the release of our holdback. So that is our testimony. I'm happy to answer any questions.
Thank you, Commissioner. Any questions from members of the committee? Seeing none, Commissioner, thank you very much.
Excellent.
We
Thank
appreciate
you.
Office of the Chief Medical Examiner.
Good afternoon. Can you hear me okay?
Yes, ma'am, we can hear you. Would you please identify yourselves for those in the room and also those online, please?
Absolutely. I'm Dr. Maura DeJoseph, the Deputy Chief Medical Examiner for the State of Connecticut Office of Chief Medical Examiner. And I'm joined today by Dwayne Gordon, who is our Fiscal Administrator. And we greatly appreciate the opportunity to give testimony here before the Appropriations Committee regarding our deficiency for this fiscal year. So you have our written testimony, but just in summary, we're anticipating an overall shortfall of $80,000 by the end of the fiscal year. All told, it's $180,000 within personal services. However, we've been able to lapse $100,000 of our OE to cover a portion of that deficiency, thereby resulting in the $80,000 deficiency. And given that our operations are 24/7, 365, we do have unanticipated costs, usually related to overtime, and that makes up the greatest proportion of this deficiency. The overtime is typically within 3 units in our office: the medical, legal, death investigators, the forensic technicians, and the laboratory assistants. And unfortunately, we did have some vacancies during this year that we've worked to try to ameliorate, By hiring 3 recent investigators, we have reduced the overtime expenditure in that unit, but we still have some other vacancies within the other 2 units, which do result in then some ongoing overtime. So given these unanticipated costs, sometimes involving our investigations, as I mentioned, overtime is where we fall short on our personnel services line. So we do our best, certainly, to stay within our appropriation, but we hope that you can understand some of the challenges we face in making sure that we keep our investigations ongoing for public health and public safety. So I'm happy to take any questions that you may have about our deficiency.
Thank you, Dr. DeJoseph. We do appreciate your efforts and certainly your testimony to the committee. Are there any questions regarding the testimony before us? Seeing none, you are the trifecta winner. You are free to go. Thank you very much.
Thank you all. Have a great day.
Appreciate that. Department of Developmental Services. We will hear from Commissioner Sheff.
Hello, and thank you for having me. One correction to my testimony, it says good morning. It should say good afternoon. You all have been at this a little while.
That's
But
not your fault, Commissioner. If Representative Nolan had asked less questions, we'd still be in the morning hour. Thank you, sir.
I heard a lot about those questions. Well, thank you all. You've had a long day. You have my written testimony. Essentially, the Department of Developmental Services has a gross projected deficiency of 9.6 million, 8.4 million from personal services and 1.2 million in other expenses. Offsetting that are one-time lapses of 1.6 million in our behavioral services program and 350,000 in the supplemental payments for medical services account due to a reduction in our ICF census. The net shortfall is 7.66 million. That is what is anticipated. So that is my testimony for you here this afternoon, and we're happy to take any questions you may have.
Thank you, Commissioner. It looks as though we have one question from Representative Nuccio.
I'm going to be as quick as I can with this. It's the same question that I had for DPH. In looking at your testimony and looking at what is currently in the OFA expenditure detail for March 25th. Again, it's looking as if you actually would have a surplus and not a lapse. So I was hoping you could maybe go back and get information as to why those are different. Right now, it looks like your budget of 1.5 million and an actual of 1.48. So looks like a $3 million lapse and not a deficiency.
Thank you, Rep. Nuccio. You just used two numbers. I'm just 1.5 billion or 1.5.
Sorry. Yeah.
That's okay. I knew
There's millions and billions up here all the time. That's pretty sad.
Millions and billions. So we will confer with OPM on what you have before you and what OFA provided on March 25th and identify for you that discrepancy and give you some explanation then.
I appreciate that. Thank you very much.
You're very welcome.
Thank you very much, Representative. Any other questions? Seeing no other questions, thank you.
Representative,
My
sorry.
apologies, Representative Dathan.
Thank you. And thank you, Commissioner. Very quick. I just wasn't clear with the 9.6 deficiency, 8.4 being personal services. Were any of those personal services in relation to overtime?
Yes.
About what percent? And is this due to hiring shortfalls?
It's due to the workforce crisis that you and I have discussed and an ability to recruit and fill those frontline positions. And we are meeting on an ongoing basis, or soon to be meeting on an ongoing basis with OPM to discuss both overtime reductions as well as ways to facilitate bringing online frontline staff so we can mitigate that in the coming year.
Great. That's what I figured. So it's frontline staff mostly.
The bulk of that is we are while there is overtime that occurs in other bargaining units and in other pockets of the agency on a $1.5 billion budget, it is relatively negligible. The bulk of what impacts our ability to meet that PS line is in the direct care workforce where we can't not provide the service because there's people there needing support in our 24.
Absolutely, absolutely. I just wanted to clarify. Thank you so much, and I do hope you guys are able to fill those needed positions quickly. Thank you, Mr. Chair.
Thank you, ma'am. Any other questions? Seeing none, thank you very much, Commissioner. We appreciate your efforts.
Thank you, Representative. Have a good day.
You too. Next we have Demas up. Commissioner, good to see you.
Good afternoon.
You're welcome to start whenever you choose.
Thank you.
You're welcome.
So I'm Nancy Navarrete. I am the Commissioner of the Department of Mental Health and Addiction Services. I have with me Cheryl Aurora. She is my CFO at Demas. You have my testimony before you. I'll jump to a summary, which you can find in the third paragraph of my testimony. Things have changed since March. We had a release of personal services savings in the amount of 7.6 million. We also attended the FAC and had some transfers on April 3rd as a result of that meeting. So we are currently projecting a deficiency in the personal services account of 25.1 million. This is partially offset by lapses they're small lapses, but 109,000 in young adult services, 100,000 in the forensic services account, 65,000 in the managed service system account. And so our net deficiency is $24.8 million, which is actually also good news, a 15% decrease from the original estimates, even after we take into consideration the release of savings. So we're taking a multi-pronged approach to reduce overtime in our personal services for the next biennium, including continuing our recruitment efforts, streamlining scheduling and timekeeping, and collaborating with OLR and DAS. Also, if you look at the governor's proposed budget, there are some right sizing of our line items, things that have historically gone over budget that we don't have control over, like electricity and food costs, things like that. So I can go a little bit more detail into the background. We originally had a shortfall of 18.5 million in PS, and we were able to reduce that by 1.5 million by focusing on overtime and overtime control. So that's good, and we'll continue that into the next 2 years. This deficiency decreased to 9.4 million with the release of savings. The FAC consolidated our deficiencies into one line. We were able to use $3 million in lapse from the Behavioral Health Recovery Services program, and that results in the 25.1 million deficiency in the one account. So we're able to pay our bills in the other SIDs. So you'll see on the second page of the testimony is a little grid. I hope explains more clearly what I just gave you in the narrative. But certainly if you have any questions about this, I'd be happy to answer them.
Thank you, Commissioner. Are there any questions before us? Commissioner, I think you're good to go.
Thank you.
You're welcome. You seem very pleased by that, and I'm pleased for you. We'll now take the Department of Social Services. You all are more than welcome to start when you so please. And just for the record, introduce all of yourselves to us so that we have that on the record for the clerk and also for those at home. Thank you.
Good afternoon, Representative Paris and members of the Appropriations Committee. My name is Peter Hadler. I'm the Deputy Commissioner with the Department of Social Services. Commissioner Barton Reeves sends her regrets that she's not able to be here today, but we will, as a team, hopefully help to fill in for her and answer any questions that you may have. And I'm going to turn it to our CFO, Brianna Mitchell, to introduce herself.
Good day. My name is Brianna Mitchell. I'm CFO for DSS.
Hi, good afternoon. Bill Halsey. I'm the Medicaid Director at DSS.
Thank you very much. I imagine we'll likely have questions after your testimony, but you all can start whenever you so choose.
Good day. So the agency has submitted a written testimony that summarizes deficiencies in our accounts, which we're happy to discuss here with you today. The current Medicaid deficiency is 248.3 million, and it's a net deficiency after all other shortfalls and surpluses have been considered. Throughout state fiscal year 25, the primary cost drivers of the Medicaid deficiency consist of the enrollment mix, home health, home care, and waivers, pharmacy and rebates, and other unfunded costs that are largely the result of utilization increases above what was assumed in the enacted budget. The enrollment mix is categorized as Huskies A, C, and D, and the original caseload was projected to decrease in fiscal year 25. Although in Huskies A and D enrollment has decreased, it is still higher than pre-pandemic levels. Husky C enrollment remains steady, but members have higher cost of service costs. The PMPM for Husky C enrollees did increase from $3,105 in fiscal year 24 to $3,339 per person in fiscal year 25. And the average PMPM has increased 13.9% quarter over quarter from December 2023 to December 2024. Our next driver is home and community-based services. The HCBS services has become both preferred and a lower cost alternative to institutional care for recipients requiring long-term services and supports. The Connecticut Home Care Waiver is the largest of the DSS waivers with 14,900 monthly recipients at an average cost of $3,500 per person. And those members, excuse me, increased at 100 participants per month since early state fiscal year 2023. The Community First Choice is, excuse me, serves approximately 5,900 recipients and adds approximately 650 recipients in this last year at a cost per person of $5,100. Home and community-based service enrollments are increasing faster than institutional care is decreasing. Consumer Choices has increased access or has increased costs as well as collective bargaining and minimum wage increases. Our next item is pharmacy and rebates. Our prescription drug increases are trending similar to national Medicaid drug spend. The pharmacy costs have increased by 93 million from fiscal years 23 through 24, with the unit costs increasing by 7%. Drug rebates as a percentage of pharmacy costs have been decreasing since pre-pandemic. And we'd like to note that each 1% drop is a loss of 20 million gross dollars, which is an $8 million state share. Introduction to and advertising of new higher cost drugs has led to increased utilization and spending. High cost drug examples include antidiabetics, dermatological drugs, and cell and gene therapy drugs. Lastly, DSS implemented various underfunded program mandates, which also contributed to increased Medicaid costs. An updated Medicaid budget was presented in the midterm legislative session in 2025, which highlighted updated trends and adjusted for shortfalls identified at the time by adding $106.8 million to DSS's baseline. However, the enacted budget was not adjusted. Some examples of program mandates that are unfunded include continuous eligibility, expansion of healthcare coverage for children up to the age of 15, regardless of their immigration status, and funding for psychiatric residential treatment facilities. This concludes our deficiency testimony.
Thank you, ma'am. We appreciate your testimony. Are there any questions from the committee? Representative Nuccio, ma'am.
Thank you, Mr. Chair. I think you started to get to one of my questions. You had mentioned that you had expected a reduction in member lives. and we're actually not seeing that. Beyond the three that you mentioned, which were the continuous eligibility, which I think might be the answer to my question, the illegal immigrants and the psychological residential facilities. Have you identified why we're off so much in our projections from the perspective of an expected decrease in member lives, but actually, are we fairly flat? We did have some come down, go to cover CT, but we're actually, I think Medicaid enrollment has gone up from where we were before. I think we're at about 1.2 million, close to something like that. So I was wondering if you could kind of give a little more color in there on what you think is driving that number, and why you think we didn't achieve the reduction from the recertification that other states have really seen. I think Connecticut's an anomaly in that.
Before you answer that question, Representative, I think that question is perfectly germane towards the bill at hand. But I would just like to offer a gentle correction, if you will, ma'am, that no person on this earth is illegal. In your reference to immigrants, they are undocumented. So I hope that you will allow for me to make that gentle correction, ma'am. And on the record, they will be called from now on undocumented immigrants for the case of your question. Thank you, ma'am. Please proceed.
Thank you. I'm happy to try to answer that question for you, Representative. I think in our written testimony, you'll actually see some of the overall enrollment numbers, which actually are showing that we are declining overall in Medicaid, as expected coming out of the unwinding period. So we're seeing, especially in Husky A and D, significant declines, sort of steady and significant in line with the way that we did our public health emergency unwinding, recognizing that as part of that process, some of the population was able to get transitional medical assistance, which maintained them for another year. So we're still seeing the tail of our public health emergency unwinding playing out. But the other thing to note is that our Husky C population has actually increased. About 100 individuals are being enrolled each month into some of our highest cost programs, our home care program in the community, and that offsets the decline in enrollment in some of our other groups. So you'll see the overall trend is declining enrollment, but in a couple of those high cost categories, we're continuing to see small and steady growth instead.
Okay, so it's the mix, basically. It's the mix of people who are coming on and going off is what you're saying, like from that perspective.
Yes, I think, like, again, by and large, the Husky A and D populations, which are by far the largest populations within our Medicaid program, we are seeing declining enrollment, which we expected. The thing that we were not expecting at the exact level was the increase in our Husky C population, and that has ticked upwards slightly. We don't have any particular factor to point to for that other than an aging population and people seeking out services. They're not huge numbers. We're talking about like a 1% growth, but it's a growth in a population that has very high costs for services.
Okay. And then one of the things that you mentioned specifically in relation to the home visits is that you had expect to see, which I would agree to, you would expect to see a reduction in residential. Have we seen that? Have we seen that shift for the more home-based services that we're offering, that we are starting to see a shift downward from the cost of residential programming?
Yeah, that's part of a long-standing trend that we're seeing in the Medicaid program, right? We're seeing more people receiving services in the community as opposed to in an institutional setting. We're seeing enrollment decline slightly in our institutional nursing home population, but the growth in the populations that's receiving home and community-based services is growing faster than the decline in the institutional. So the overall number of people who are receiving these services is higher, but the mix is shifting more towards human community services, which is more cost effective overall.
Okay, and I guess if you have anything that documents and shows that, I'd appreciate seeing it, because we've heard that quite a bit about the shift between residential and home-based. And I'd like to actually see the numbers so we can actually track to see what that savings looks like as we forecast it out. So if you have that information, I would greatly appreciate it.
Yeah, we can certainly provide that.
All right, thank you so much.
Thank you so much, Representative, and thank you for the answers. Are there any other questions? Representative Dathan, followed by Representative Johnson, 2 questions each. Thank you.
Thank you, Mr. Chair, and thank you for your presentation today, DSS. Just wanted to clarify, our biggest result is for this shortfall is due to the Medicaid plans. If you all would have able to adjust your budget last year to the amount for this current year, what would the shortfall have been? And were you planning on the same numbers for your PMPM for each of the different Husky programs?
So had, excuse me, had we received that 106.8 million, that would have reduced the deficiency of 248 by that amount. What was the remainder?
Yeah, that was kind of the question, but I was just trying to understand that if you had received that, would you have adjusted the Husky A, Husky C, and Husky D enrollment numbers and utilization trends as part of that, or was that initial adjustment part of another amount? Was that just for prescription drugs or whatever? I'm just trying to understand, hindsight, of course, is 2020, but if we had an opportunity, would the agency have adjusted these utilizations and enrollment numbers differently as part of the reforecast of the 25 budget?
I can give it a shot at starting that answer and welcome my colleagues here to jump in as well. I think that the original amount that we identified, the $106.8 million, was a combination of a number of different things that contributed to that. One of which is an increasing per member per month cost that we've seen that growth continue to accelerate over the past year, or in this state fiscal year, which is one of the drivers of the deficiency. So I think that it would have helped if we had set the baseline last year and accounted for those proportions, but we would still be seeing some additional deficiency because the growth in the per member per month costs has grown even faster this year.
Okay, so then for my second question, in your last section of your testimony, you talked about other factors, and some of these are newer policies. Were there any policies listed here that took into effect fiscal year 25 that were not part of our original budget in the biennium?
No.
Did that make sense? Sorry.
The answer was no, Representative.
Oh, I'm sorry, I didn't hear. Thank you so much. Thank you, Mr. Chair.
You're welcome, ma'am. Representative Johnson.
Thank you, Mr. Chair, and thank you for your testimony today and your work. Just a follow-up question. There's an increase in home care provision and a decrease in skilled nursing facility care. In terms of the data, do you have data that describes, say, someone who went through the process of, say, hospitalization or needing home care services, and then being discharged from that because of the need for more comprehensive care back into a skilled nursing facility? You have that provision that we also have for observation assessment at the hospital level, so that maybe what you have is an initial hospitalization, and then you have the discharge either to home care or to skilled nursing facility, and then maybe back to the hospital and to the home care. In other words, do you have that in terms of your audits and how you're looking at that? I know the federal government does the audit. I'm not sure what you do.
I'm happy to jump in there. So as long as Medicaid is paying for all of those services, Rev Johnson, then we could track that flow, whatever direction that member happens to be going, hospital to skilled nursing, back to hospital. So we can do that on a case-by-case basis as long as the Medicaid program is paying for all of those services.
And just to follow up on that, do you have that data in what happens on an annual basis with all the Medicaid beneficiaries?
That exact flow?
Yes. or maybe one of the flows that I described.
I'm trying to think of all the reports that we get. Can I get back to you on that?
Absolutely,
Yeah,
but
okay.
thank you so much. Appreciate it. Thank you, Mr. Chair.
Thank you, ma'am. With no representative corpus.
Thank you. Thank you for all you're doing. Have you all been affected by federal cuts? I have a particular concern in your area because it's directly related to our citizens' health care and daily well-being, either in 25 or 26.
That's a very good question, Representative. It is something we were monitoring extremely closely. There's so much change going on right now at the federal level. We are still gauging the impact across a lot of our programs, not just the Medicaid program, though we are also very closely watching, Congress's activity around budget reconciliation right now and anticipating that there might be significant changes to the Medicaid program coming soon. So this is a situation we continue to monitor and sort of take on a case by case basis, depending on what particular activity may occur.
Thank you. Any other questions? I'm looking at Senator Lesser, who looks as though he's thinking of whether or not he has a question. Senator Lesser, go ahead, sir.
No, thank you. Thank you, Mr. Chairman. I've had plenty of opportunity to ask some questions about DSS, and I will not take up the committee's time at this point, but I really
Thank you.
appreciate it.
Thank you, thank you, Senator. I appreciate that. Seeing no other questions, you guys are free to leave. Thank you very much for your testimony and for your answers. We appreciate that. Next up, we have CTEX, Dr. Alice Pritchard, who is the Executive Director of the CTEX. Please join us. Thank you. Dr. Pritchard. Thank you for being here with us today. You may
Absolutely.
begin at your leisure.
Thank you very much, Representative Paris, Representative Nuccio, members of the Appropriations Committee. My name is Dr. Alice Pritchard. I'm the Executive Director of the Connecticut Technical Education and Career System, or known as CTEX. I won't read you my short testimony, but I do want to say a few things. For those of you who don't know our system well, we are operate 17 diploma granting high schools, and have tech centers and adult programs as well, where you're serving about 11,000 high school students and about 1,500 adult students in our system, and hope to serve more in the future because we have a lot of demand for our system. And we are over 100 years old, so we have lots of great history, but we are also a brand new state agency. And so this most recent biennial budget was our first as a standalone agency. We have been working to stabilize and better understand our cost drivers. And I do want to just take a moment to thank Keisha Richardson, who has for the last many years tried to hold down the fort on the fiscal front, and has done an amazing job. And I'm indebted to her for the help she's given me in the 4 months since I have been here. We have just hired our very first CFO of the independent agency. So we hope to be, with that additional capacity, we hope to be able to answer more of your questions in the future, but just wanted to raise that point. So there are a number of factors that are leading to our budget deficiency this year. It is 13.4 million per OPM's latest monthly letter. In particular, special ed costs, which I know you all have heard a lot about. Our special ed costs in both PS and OE have increased from about 10 million in 2022 to 22 million in 2025. So that is certainly one of our drivers, as well as you've heard from so many others today about the fixed costs that have increased for us by about $1 million. To the representative's questions, we have already encountered the end of ARPA funding, which has been impactful for us, not new cuts, but we lost money in September, or the end of our ARPA ESRA money ended in September. That required us to take on 33 staff people onto our PS budget, as well as other expenses that have been paid for during ARPA. So that also is part of the cost drivers as well. And then just again, the inflated cost of commodities. We spent a lot of money in our trade areas. Consumables have gone up for us. We feed students every single day, and those costs have gone up considerably. So we just have a lot of things that are increasing our cost, and that burden has fallen on our operating expenses and on our PS this year. But we are working diligently to reduce those things. We actually had higher projections for deficiency when I arrived in December than we have today. And so feeling good about our direction, but nonetheless find ourselves in this position today. So I'm very grateful to the committee and to the administration for your support as we are making so many transitions in this system at the moment, and very happy to answer any questions if you have them.
Thank you, Director. Are there any questions? Seeing that there are no questions, thank you very much for your, your overview and summary. We appreciate that. Next, we have the Teachers Retirement Board, which is online. Helen Sullivan, the administrator, and Bob Rybert, who's the fiscal administrative manager.
Good afternoon. Helen Sullivan, the administrator at Teachers Retirement Board. I have Bob Ribera with me as well. Thank you to the committee. We appreciate the ability to join online as we are testing final phases to get our 4CT project payroll launched for our retirees. So it's all hands on deck over here. So we appreciate that. We'd like to discuss our testimony. You have our written testimony submitted. We are here today to discuss the shortfall in the state funding, and that is for our retiree program for the teachers who are on a Medicare benefit program. I believe Mr. Wojcik did a really great job this morning explaining the Inflation Reduction Act and the federal CMS changes that have impacted those rates. Again, they are related to the prescription drug program and the Medicare payment program for our members. If you'd like to begin with some questions, that's great. We are operating at a $9.7 million deficit. In 2024, the state share was $36. That was the 1/3 for our base plan. We have about 32,000 members who participate in the program. With the Medicare Inflation Reduction Act for 2025, that state share increased to $94. So we are open for some questions if you'd like to discuss the changes that CMS made this year and how it impacted our programs.
Thank you very much for that summary. Are there any questions from the committee? Seeing no questions from the committee, you're free to go. Thank you very much. We'll now have the judicial branch, followed by the Public Defender Services Commission, and then followed by the Department of Corrections, in that order. Thank you.
Good afternoon, Chairman Paris.
Thank you.
And Representative Nuccio and all other distinguished members of the Appropriations Committee. My name is Beth Bizzuto, and I am the Chief Court Administrator of the Judicial Branch. I'm pleased to have with me today, to my right, Brian Hill, who is the Executive Director of our Administrative Services, and to my left, Ron Woodard, who is the Director of our Financial Services.
Perfect.
We've submitted more detailed testimony, and I will just briefly summarize it. Our overall deficit is 11.7 million, and it falls into 3 different lines. The first line being personal services. We're requesting $4 million. It was originally $7 million, but we've already implemented some mitigation strategies. And the remaining $4 million is a result of the 21 new Superior Court judges and 1 support magistrate who were appointed in March of 2024. And our most recent class of judges who were appointed in March of 2025. We received 12 new judges and 2 family support magistrates. They actually just finished their pre-bench education yesterday and take their first day on the job, on the bench by themselves today. The second bucket, or line item, I should say, where we're experiencing a deficit is in our other expenses. We are short by 5.7 million. And that deficit falls into 3 primary categories. One being our software licenses. Since we've moved to a subscription-based software for Microsoft 365, our annual licensing costs have risen nearly $3.6 million. Also, our utility costs, especially electricity, which has increased by 39% since 2021. We do operate out of 35 courthouses and 35 administrative buildings across the state. And also, of course, premises maintenance. We've experienced a tremendous increase in that contracting. And the final line item would be our other current expenses, and that falls into two different categories. Our adult alternative incarceration, where we would experience significant increases in our contracted services for bilingual translation for non-English speaking clients, increased demand for our court-ordered domestic violence programming, as well as our GPS monitoring. And then on the juvenile side, the deficiency is due to payments related to emergency out-of-home placements, our increased medical and mental health expenses, and lower than expected projected returns from our various providers. So we're happy to answer any questions that you may have, and we appreciate your attention to our requests.
Thank you very much for that summary. Are there any questions from the committee? Representative Nolan,
Good afternoon.
two questions, sir. Germane to the bill before us, which is the deficiency bill,
All right, let me see.
not his podcast.
So I'm very concerned in regards to the last paragraph in what we're reading in regards to the projected deficiency of the juvenile justice overreach services and alternative incarceration program and care for children. Could you share what measurable outcomes or successes can be derived from the juvenile justice outreach service that demonstrates why maintaining or increasing this funding is essential for keeping youth out of deeper justice system involvements?
I'm going to turn that over to Brian Hill, who would be happy to answer your question.
Brian Hill, Executive Director of Administrative Services. Thank you for the question, Representative Nolan. And I think it's exactly what you said right at the end of your question, which is the services that are provided under this funding help to keep these young people out of the deepest end of the system. Just 6 or 7 years ago, we were incarcerating in Connecticut many kids at the Connecticut Juvenile Training School. And through the actions of state government, primarily the legislature, we made a policy change to move more kids out of incarceration and closer to their homes and their communities and provide in-home services and try to limit the number of kids that we have in incarcerative settings. And so the funding here is to divert kids away from the system, to appropriately treat kids who are in the system, primarily through cognitive behavioral therapies, other group therapies, in-home services, and then when necessary, provide residential treatment in staff secure and secure facilities for the small number of kids who require those services because of public safety or other greater personal needs.
Thank you for that detailed answer. And I just really feel that that divert area is like the really big and strongest part of that, along with some of the diversionary programs that we must maintain in other areas also. And my second question, because I don't think I'm going to be able to ask a third, and I don't even know how to combine the two, so I'm going to just ask the second. Could you share how the alternative incarceration program help reduce recidivism and incarceration costs, and what risk we run if we underfund these preventive alternatives also?
It's probably a similar response.
That's okay.
That Mr. Hill just
I want to
provided.
give that
Brian,
opportunity
would you
to
like to
share.
provide that? Yeah.
I want to make sure that people understand how these cuts affect our communities in devastating ways, I believe, because it opens a door that becomes that revolving door that we're trying to get rid of. So,
You know, speaking as a judge, Representative Nolan, I could tell you has a real impact on the courts because they don't have those tools and options available to really worthy defendants that are before them, who struggle with addiction or homelessness or mental health, who don't belong in a jail, probably don't even belong in court. And those resources wither, so the court has less options. which results in a higher pretrial population.
Correct.
But I'll turn it over to,
And saying that, it goes right back to the policies that we set as legislators. We set policies and we underfund them. And this is just one of those policies that continually be in question as today, so. that's
and
why
it
we're
leads to
here.
the revolving door that you said as well, because
Correct.
you can't keep someone incarcerated on misdemeanors because of a drug addiction
Yes,
forever, right? I mean, just is not right. So eventually they're released without any support, without any services. And we know what happens after that.
yeah,
They revert right back to the behavior that brought them into the court system originally. So it's similar to what happens with the juveniles, but I'm sure Brian would have some more
I'll
detailed
let
information.
him give some
Yeah.
more detail, because I feel this hot thing on my neck right now.
If you could have those details after the committee, after the public hearing, I think that would be helpful. I think Representative Nolan is stretching a bit, so I would appreciate if the answers are very similar, that we have that as an offsite conversation. Representative, would you indulge us around that?
Of course.
Thank you, Representative. Can't trust too many people from New London, you know, they just take an extra mile. Any other questions from the committee members? Representative Johnson.
And I just want to follow up with Representative Nolan's question and make sure that the whole committee gets to see the answers to that. I think that's very, very important information. Thank you, Mr. Chair.
Thank you, ma'am. I appreciate it. Seeing that there are no other questions, I think you all are free to go. Thank you
Thanks
very
so
much.
Thank you very much.
We'll now have the Public Defenders Services Commission. Hello, how are you?
Good afternoon. My name is John Day. I'm the acting chief public defender. With me is Stephen Hunt. He's the finance director for my agency. Thank you very much to all the members of the committee. I know it's starting to wane on here a little bit with time.
Mr. Day, would you mind getting closer to the microphone if possible? Thank you.
Yep. Maybe to anticipate some questions, I'll answer a couple of things up front. No, we're not impacted by any federal government money that's been taken away. We are a state-funded organization. No, we do not pay any overtime. And we have taken several steps and continue to take them for mitigation and efficiency and cost savings. So with that said, I will highlight rather than read the entire testimony into the record. We have a $1.1 million shortfall, and this is due to the collectively bargained increases by our attorneys union, and that was done to keep in parity with the state's attorneys union regarding steps and compensation. We were able to mitigate that by about $650,000 due to an overage in the assigned council budget. It's in the testimony. So with that said, I'm happy to answer any questions in the interest of time. I know you have one more behind me. I thought you anticipated me being the last one, but here I am to fire away.
Thank you. Are there any questions? And before Representative Nolan comes back in, I think that we should probably get you out the door.
Thank you very much for your
Thank you
time.
very
Have a
much.
good afternoon.
Thank you. Next up and last, we have the Department of Corrections. Commissioner, good to see you.
Good to see you.
Thank you. You may begin, sir.
Good afternoon, Representative Parrish and distinguished members. I am Angel Quiroz, Commissioner of the Connecticut Department of Correction. To my left is Michael Regan. He's the Chief Financial Officer for the agency. On April 13th, April 3rd, 2025, the Finance Advisory Committee meeting, the committee approved the transfer of $34.6 million from the agency's personal service account, $4 million from the community support service account, and $1.4 million from the boards and pardon. The amount to cover a projected $21 million deficit in the other expense account and $19 million deficit in the inmate medical service account. So the total deficit for the agency in personnel services is $40.6 million. And with that, I would take any questions that the committee may have.
Thank you, Commissioner. Are there any questions from the committee? Representative Nolan. Can't find his questions. Any other questions from the committee? Representative Corpus.
Thank you. Thank you for indicating where the shortfalls were, but pardon me if I don't know how the names of those accounts relate to specific services. What was essentially the genesis of this 42 million? In your underlying work, what generated those deficiencies?
Absolutely. I'm gonna allow my chief financial officer to speak on that.
Okay, so the two deficient, well, we had three deficient areas. We had personal services, we had inmate medical services, and we had our other expenditures. So the costs associated with our other expenditures deficiency were related to utilities costs, food, pretty much everything that goes into running our organization outside of our labor costs. So as I said, clothing, food, utilities, other supplies that we use, premise repair supplies, cleaning supplies across the board. For inmate medical services, our costs, deficiency costs were in personal services, which is separate from our regular personal services line, as well as pharmaceutical costs and outside medical services. And personal services are mostly related to position vacancies, which are driving our overtime costs.
And if I may, and in the operating expenses part of it, was that because things were more expensive than anticipated, or did you have a larger population to serve?
There's a couple things at play. Number one is we inherited a structural deficit that's been carried forward for the past couple fiscal years due to unrealized savings from facility closures. And the fact that the FY25 budget wasn't opened, so that couldn't have been adjusted for this year. But in addition to that, we have seen significant cost increases due to inflation, as well as a higher than anticipated inmate census. We are over 1,000 folks higher than we were the previous year at this time. And all of our costs are per capita with regard to food and clothing and things of that nature.
Thank you very much. We appreciate that. Representative Reyes.
Thank you, Mr. Chair. Commissioner, good to see you.
Nice to see you.
Yeah, so my question is more towards the productivity and where you are with your the officers are as far as capacity. I heard that you're running the overtime's a little high because you're short officer. How many are you short? And what is your best number for a productive operation?
Yep. So the just for the record, the overtime is very high. We are right now 483 correctional officers vacancy. Last Friday, a class of 100 correctional officers started the academy. They will go through the academy for 14 weeks and then another 4 weeks in OJT, and then they will be back on the line, hopefully mid-June. We're in conversations with OPM for 2 more classes for this by the end of 2025. We're looking to add an additional 300 correctional officers. That will bring us down to the hundreds. However, every month I'm signing off on retirements letters for correctional officers that are retiring. So I'm hoping that by the end of the year that we should be probably around 200 to 250 vacancy. And then for 2026, we're projecting to have probably 3 or 4 more classes of correctional officers in order to be properly staffed. And even when we are properly staffed, our workers' comp numbers are very high. This month, we're up to 165 individuals that are out on workers' comp. So even though on paper, I may show some facilities at high 80%. When you subtract the workers' comp number, it's lower.
Well, thank you, Commissioner. And I kind of knew the numbers were up there, but thank you for clarifying it and putting it on record because I think it's important for us to understand the overall scheme of Department of Corrections. And thank you for bringing up the workers' comp situation because that plays into it. These are numbers that are on your head count, but actually not being productive. So I thank you for answering the question. I thank you, Mr. Chair, for the indulging me.
Thank you, Representative. Representative Nolan, Representative Delnicki, and then Representative Nolan. My apologies. Followed by
just-
Representative Johnson to close this out. Thank you.
I just want to follow up on the workers' comp issue. You said 165. Is that pretty much a constant throughout a year, or is it a rise and a fall? And you have some times where it's much higher than that 165?
So, great question, Representative. So let me clarify too. That 165 I mentioned are individuals that have been out of work for more than 30 days. Right. So for the calendar year of 2024, there was over 800 individuals that were out on comp. Could be one day, could be a week, and could be 2 weeks. But right now, as of today, I got 165 individuals that have been out for more than 30 days. The summertime spikes. So we're getting ready now when the weather gets better. Those worker comps number of certain facilities will increase.
So it's safe to say that a substantial cause of the shortfall is a workers' comp issue, is an injuries issue, is people basically burning out, for lack of a better term.
So the majority of the workers' comp are responding to an incident or involved in the separation of use of force. The workers' comp number is a second driver for my overtime. So my first driver for the overtime is the position vacancies. The second factor is the workers' comp.
And that was my reference of burning out in the job, is the fact that they're working so much mandatory overtime.
They're working mandatory overtime, absolutely. Yes.
Thank you for your answers, and thank you, Mr. Chair.
Thank you, Representative. Representative Nolan.
Thank you, Mr. Chair. How you doing, Commissioner?
I'm doing great. How you doing?
Coming before us, and thank you for all you do to hold it down for us, for those who need a little help sometimes. But we know that, you know, you're doing a good job. But I want to ask a question about, given the rising costs and population increase, how is the department balancing facility needs with community-based programs like reentry service or alternatives to incarceration that may reduce long-term costs?
So right now it's being balanced. It has not been an impact on the needs in the facilities or the needs in the community. We still got 1,181 halfway house beds out in the community. We also have 234 apartments for the wraparound services that are in the communities. But I do think that in the near future, when the RFP goes out for the halfway house beds, that those prices will be higher, and we'll have to take a hard look at how many beds we can afford. And it's concerning too, because as the population continues to rise, you know, that's a concern.
Okay, and my next question is, like we ask others, are there ways the state can better prepare or predict these types of increases in inmate-related expenses to prevent such large deficiencies going forward? And for the information you just talked about, if you could send that to the administrator in regards to how many of the beds that we have and halfway houses that you're related to, and some of their names, so we know where they're located.
Okay, will do. I'm sorry, what was the question again?
Are there ways the state can better prepare for or predict these types of increases in inmate-related expenses to prevent such large deficiencies going forward? Thank you, Mr. Chair.
Thank you, sir.
I will start, and then I'll let the Chief Finance Officer jump in. Right now, I'm focused on the unsentenced count, as that unsentenced count continue to rises. OPM is projecting that by the end of the year, we'll be probably at 11,600 at the worst case scenario, over 12,000 individuals incarcerated. So that will play have a big impact on the bed space that's available. As you know, I closed 3 facilities during my tenure as a commissioner. I do have the last facility I closed, Keychron ready on standby, and hopefully we'll never have to go back in there. But I am monitoring the census of as it continues to go up. If it stays around the 11,500, then we can continue operating as normal. Hopefully I answered your question, Representative Nolan.
Yes, that was satisfactory. Thank you.
Thank you, Representative. Representative Johnson, followed by Senator Lesser.
Thank you so much for your testimony and your work. I'd like a little clarification on the workers' compensation issue.
Sure.
Those, I believe, are based on physical injuries that are sustained by the corrections officers.
Yes,
So they are hurt in the line of duty.
yes,
And so that would be why you have so many people who are out, because they are trying to address some type of issue that is going on to protect the rest of the people there in the prison
yes,
population. Okay, just for point of clarification, it has to do with injuries, not tiredness or anything like that.
correct.
The other question that I have has to do with the fact that I wonder if you have a breakdown in terms of people that have behavioral health disorders, the range of the disorders, the amount of the psychiatric and psychological and APRN oversight in those circumstances, for which we used to have a behavioral health facility for, which now you're operating as a prison. I just wondered what you have in terms of data so that we can see how that is being addressed.
Representative,
Yes.
I apologize, I have to cut in. That's not germane to the bill that we're speaking about, which is the deficiency bill. But I'm happy to have the commissioner answer those questions for you offline, if that's all right.
Well, that's fine. I just thought it was having to do with the deficiency since they have workers' comp issues. And it is related to workers' comp.
Understood. Continue.
May I respond to?
Yes, sir.
We did provide that information in the appropriation hearing, so we will resend it to you.
That'd be
Representative
great
Johnson.
because I get a lot of information. I appreciate that. And I'll be glad to chat with you afterwards.
Yes.
Thank you, Representative. Senator Lesser.
Yes, thank you, Mr. Chair, and I know that this is the last group we're hearing from, so I want to be respectful of the committee's time. But just with respect to, I know that one of the areas where you're experiencing deficiency is on inmate medical, and didn't know if you had any information about what the big cost drivers are there, and specifically, I know you're part of a purchasing, or I understand you're part of a drug purchasing consortium with other states. Are you seeing trends with respect to prescription drugs that you can speak to?
So the way we address our pharmaceutical needs is through a contract with a pharmacy services company. So we are paying for the company that we contract with makes their money through fulfillment. We get the pharmaceuticals from them at basically cost, so it's a wholesale cost. We do find our some increase this year in pharmaceutical costs, but it's not based on a per unit cost increase. It's based on the mix of pharmaceuticals that are being prescribed. So what we've seen over the past few years is an increase in the prescription of drugs that fall into the class known as biologics. You've seen Humira, basically anything that there's an ad on TV for these days. Those types of drugs, they're more expensive. They tend to be administered through injection. And at one point in time, they were the drug that you used after you prescribed everything else and nothing else was working. Now you went to these more expensive drugs. Over the past several years, they've become the first line treatments now, the standard of care. And we follow the standard of care. So we have seen an increase in the usage of those drugs. And that's really what's driving our pharmaceutical cost increase.
And is what is driving the overall growth of inmate medical? Is it pharmaceutical, or are there other costs that
No,
are really bigger drivers?
there's about 3 areas of costs. I mean, just about anything we spend money on is more expensive these days. You know, we've had massive inflation over the past several years. And even though the inflation numbers go down, those cost increases don't go down. They become the base cost. And you probably see that in your own life when you're going to the grocery store. Yes, prices do come down a little bit, but they never go back to what they once were. We're seeing increased costs in pharmaceuticals because of the mix of pharmaceuticals that we're prescribing, but we're also seeing increase in costs associated with outpatient services. Not just because they're more expensive, but because our volume is up. Our inmate population is older and have higher acuity levels. We have people with multiple issues. They're just not a well population. So we see those costs have increased. And then there's our costs of personnel associated with administering that. Healthcare is expensive. These are expensive positions. And as our population goes up, the demand for health services goes up. And as I've stated before, we're about 1,000 people above where we were last year, and about 2,000 people were above where we were 2 years ago when this budget that we're in now was first determined.
Thank you very much. Thank you, Mr. Chairman.
Thank you, sir. Any other questions? Representative Del Nicky. For the second time, I believe, sir.
Thank you.
You're welcome,
Mr.
sir.
Chair. I just want to get a little better understanding of, you explained the workers' comp issue pretty well. So my understanding is there's mandatory requirements on a needed basis for people to stay over. What is the typical, and this may be kind of tough, but what is the typical amount of overtime an average CO would have as required by mandatory staying over based on the folks that are out on workers' comp, injuries, whatever?
So, Representative, I do not have the average, but I can get you that from our data unit and get that to you. Some overtime is volunteer overtime. The individuals volunteer to stay the overtime. When there's mandated overtime, say if I'm Officer Kiros and I'm getting drafted today for second shift, well, when I come back to work tomorrow, I can't get drafted by the based on the CBA, the collective bargaining agreement. So the individuals, if there is some burnout, it's not the burnout from the mandatory overtime, because we can't hire you on 2 days in a row. The burnout may be of the individuals that are volunteering to work the overtime where they're doing 3 or 4 days in a row, working 16 hours.
That's got to be a daunting challenge.
It is.
For you to have a staff there working those kind of hours. And the second half of my second question is.
For clarification, sir, is that second half of second question? Wouldn't that be a first half of second question? Okay.
First half of the second.
Thank you, sir.
How's that? So based on what you've got there, what kind of absenteeism do you run into when some folks just can't work anymore?
So
now I know you talked about the folks out on workers' comp, but the folks that have to call out on a medical day just to clear their head.
So what I've seen over the last 5 years after COVID, that our staff, the FMLA, both state and federal, it has increased. The sick usage has increased, so there are more, I started in 1989, so in 2025, there are more benefits of accrued leave for the staff members as they deserve it, but they're more and they're utilizing every benefit that they get. So we are seeing a significant increase, and that is related to the job when it comes to the mental health piece, and folks using more of their accrued time.
And I'm not asking for an answer on this one currently. I'm asking you if it's possible to give us some documentation pertaining to the kind of hours these folks have had to work to do the job.
Yes.
To ensure that both the folks, the COs and the inmates are safe.
Yes.
I believe that required an answer, sir. And that was noted by a good member of the Republican Party, sir. Not me, Representative. With that said, there are no other questions from committee members. Commissioner, thank you. Yes, go
May I
ahead.
just answer one question? To the
Absolutely.
representative. We have not been affected by any cuts from the federal government, and we know exactly the amount that will be impacted if we ever get there.
I don't think that counts at all as my question, so that's really good. Thank you for bringing that up. Did you mean that you you know exactly the amount that would be affected in 26 potentially? Is that what you meant by your?
No, so our budget's only $8 million funded by federal grants, and it has to do with the MAT program and the education program.
And that's
that's
stable for
stays now.
25 and you
Yes.
don't have to see anything on the horizon for 20.
Correct.
Thank you so much.
Thank you. Commissioner, please run. Thank you very much. I think that concludes our public hearing. Are there any announcements regarding our next meeting or public hearing dates?
Not that I'm aware of.
Thank you very much. Thank you all very much.